kapag yung isang contestant po or isang participant natin po ay makapagbigay ng tamang sagot via the chat box, based sa binigay na tanong po, will be our first contestant for the 4-pick 1 word. Clear po ba sa lahat po yung instructions natin?
Po.
Ano po yun? Yes? No?
Yes po, ready.
Yes.
Alright. Feeling ko nga yung iba parang ready na, nag-practice na siguro dahil galing pa po sa previous episode. Sige, try po natin po ngayon yung ating first question. Now, for the first round, please type and submit via the chat box the complete address of the Occupational Safety and Health Center Regional Extension Unit number 6. Once again, para sa first round po natin, please type and submit via the chat box below the complete address of the Occupational Safety and Health Center Regional Extension Unit number 6. Once again po, isulat po natin sa ating chat box yung complete address ng Occupational Safety and Health Center Regional Extension Unit number 6 dito sa Western Visayas. So yung nagtamang sagot po ay, grabe talaga, para nag-research po. Tama po si Ma'am Jacqueline. Ma'am Jacqueline, ano po ito? Mahaba yung pangalan. Ma'am Jacqueline, online ka po ba? Pwede pong pwede po mag-unmute?
Yes, sir. Online.
Alright, very good. Kasi ikaw, ma'am, yung maging first contestant natin para po sa ating 4-pick 1 word.
Thank you.
Ready na po ba, ma'am?
Yes.
Alright, sa ating 4-pick 1 word, ma'am, meron pong tatlong kategory: safety, health, and environment.
Okay, okay, sir.
Pili po tayo, ma'am, ng isang category and one number. Kasi 4 po, ma'am, yung items per category po. Ready na po ba tayo, ma'am?
Yes.
Anong category po, ma'am, yung gusto niyo po?
I'll go for safety.
Alright, safety po yung pinili ni Ma'am Jacqueline. Ma'am Jacqueline, pili po tayo ng number.
Number 1.
Alright, number 1 po, ma'am, yung pinili po natin. Ito po yung ating pong katanungan o ang ating pong challenge. Ma'am, ano po yung hinahanap po dito sa 4-pick 1 word?
Di po, garang bulsa ang ginagana.
Hazard?
Final na po ba yan, ma'am?
Yes.
So, tingnan po natin kasi po yung final po na answer ay... Tama po ba? Hazard po. So, Ma'am Jacqueline, nanalo po kayo sa first round po bilang first contestant po natin. So, yung maging prize mo po ay isang OSH standards na book. Hard copy po yan, ma'am, from the Occupational Safety and Health Center dito po sa Western Visayas. Taga saan po tayo, ma'am?
I'm currently connected in St. Therese MTC College, La Fiesta.
Ay, salamat. Taga Iloilo City lang naman pala si ma'am. Ma'am, if ever po may time po tayo, punta po tayo dito po sa office po, ma'am. or baka po gusto niyo po invite nyo kami para pumunta rin po dyan to conduct kahit po an OSH orientation para po mismo may bigay ko na rin po yung OSH standards po, ma'am. I-ready na po namin para sa iyo po. Later on, ma'am, hingi na lang po ako ng additional details po, ma'am, para po we get in touch po regarding your price. Thank you very much po, ma'am.
Thank you po.
All right, now we proceed once again to our second contestant. So natapos na po yung first contestant para sa round 1. Punta na tayo sa second contestant po natin na kung saan po pwede pong manalo ng isang OSH standards na book from the Occupational Safety and Health Center. Alright, yung ating tanong po, mag-ready na po sa chat box mga kaibigan. Now, for the second contestant, yung tanong po natin, ano po yung official email address ngayon ng Occupational Safety and Health Center, Western Visayas? Once again, ano po yung official email address ngayon ng Occupational Safety and Health Center, Western Visayas? Ayun! May tamang sagot na! Sir Jeffrey Corpus!
Yes, sir. Good morning.
Good morning, Sir Jeffrey. Taga saan po tayo, sir?
Currently po, sir, dito po ako sa Pangasinan.
Oh!
Yes.
Para mahirapan tayo, sir, sa OSH standards. Pero sige lang, sir.
Okay lang,
We'll
sir.
find way, sir. I-connect na lang namin po sa OSH Vocal din po na malapit sa Pangasinan. Sige, sir. Pili po tayo ng category.
Sa health na lang, sir.
Health. Alright.
Yes po.
Sir, pili po tayo ng number.
Number 3.
Number 3. Sir, for number 3, ito po yung ating challenge. Sir, ano po hinahanap dito?
Coronavirus.
Final answer po ba yan, sir?
Coronavirus. Yes, sir. Coronavirus.
Tingnan po natin, sir. Baka kasi iba yung spelling. Kasi po yung tamang sagot po ay...
Ayun.
Tama, sir! Coronavirus! So, Sir Jeffrey po, mamaya po, sir, after po ng ating webinar, sir, please wag po muna mag-leave the meeting kasi kunin po muna namin po yung additional details mo para makuha mo po yung OSH standards na book mo, yung price mo po for this round, first round po ng ating activity or ng ating game po. Once again,
Alright,
congratulations po sa dalawang nanalo ng first round ng ating pag-games. No, marami pa po tayo mismo po mga pag-games po mga kaibigan. May round 2 at round 3 pa po tayo mamaya po. So hopefully, no, hopefully po makasama po mismo kayo until the end po mismo. So the current time now is 9:27. We will start at exactly 9:30 po for the official start of our webinar po. So stay lang po muna po tayo po. Then at 9:30, we'll start with the activity. Thank you very much po.
It has always been an important goal of the government to improve workplace conditions in the Philippines. In 1982, the Department of Labor and Employment prepared a concept paper creating an institution on occupational safety and health from which foreign aid could be tapped. 1984, the Japanese government responded positively to the call. 1986, an agreement was signed for a 300 million peso grant aid, a project-type technical cooperation under the bilateral grant of the Japanese Official Development Assistance Program through the Japan International Cooperation Agency, March 12, 1987. The groundbreaking ceremony was held on a 2-hectare lot in North Avenue, Quezon City, with then-President Corazon C. Aquino as guest of honor. November 4, 1987, Executive Order 307 was signed, creating the Occupational Safety and Health Center as a special department under the Employees' Compensation Commission. And on the Labor Day or May 1 of 1988, OSHC officially started being part of the government's efforts to better the working conditions of the Filipino workers.
Ikinakampanya ng Occupational Safety and Health Center ang kaligtasan at kalusugan ng mga manggagawa dito sa Pilipinas. Ito ay sinasagawa namin sa pamamagitan ng pananaliksik, pagsasanay, pagpapakalat ng mga impormasyon at mga technical na serbisyo tulad ng work, environment, measurement, PPE testing at biological monitoring. Napakabigat ng tungkuling ito kaya kami ay nagpapasalamat sa aming mga partners sa gobyerno at pribadong sektor na tumutulong sa amin palaganapin ang advokasya ng OSH upang mapanatili nating ligtas at malusog ang ating mga manggagawa sa lahat ng industriya.
Based on its mandate, vision, and mission, the OSHC champions the cause of work safety and health in the Philippines. Programs to promote health and safety of workers are carried out through the following. The Office of the Executive Director, who oversees planning, implementation, monitoring, and evaluation of the OSHC operation. Under DOLE Administrative Order Number 56, Series of 2011, and DOLE Administrative Order Number 407, Series of 2017, the accreditation of occupation.
All right, once again, good morning. Magandang umaga, magandang buhay, maayong adlaw sa inyong tanan. Welcome all OSH champions and advocates to the third KamOSHtahan sa Region 6 entitled PagOSHwag Session Episode 3 for the Food and Beverage Industry. A 2.5-hour webinar on industry-based OSH compliance and best practices. I am Melvin, officer in charge of the regional unit in Western Visayas, and I'll be your host for this activity. Together with me are the regional team and the rest of the support personnel from the central office. Now we currently have 153 participants and hoping for more later on, so we hope that you can still invite your friends for them to learn a lot from this activity and may win prizes later on. Moving on, may I request everyone to please pause for a prayer, which will be followed by the Philippine National Anthem.
Our Father, who art in heaven, hallowed be thy name. Thy kingdom come, thy will be done, on earth as it is in heaven. Give us this day our trespasses, as we forgive those who trespass against us. And lead us not into temptation, but deliver us from
All right, at this juncture, now let's hear some kind welcome remarks from the head of the Occupational Safety and Health Center. Ladies and gentlemen, a round of applause for Executive Director Noel C. Binag.
Magandang umaga sa inyong lahat, mga kapatid, mga kasama. Good morning to all of you. Sana hindi kayo nabaha. Okay, I'm very pleased to welcome you all in our KamOSHtahan in Region 6, spearheaded by our regional officer, Melvin Melicoton. Melvin, thank you very much again. Napakasipag mo, Melvin. Hanggang ilan episode kaya tayo makakarating? Baka episode 100. I'm truly happy for your accomplishment, Melvin. Sana tuloy-tuloy itong ating mga KamOSHtahan. Because the information that you are giving to us will not only serve Region 6, it will also serve all the other regions in the entire country. So this is a very unique topic, very special topic, and I know, especially in Region 6, that this is the most prevalent industry. So we are here today. Hopefully, we will learn more about occupational safety and health hazards. Ano mga hazards present in the food and beverage industry. I hope our resource speakers will be able to explain to all of us the importance of safety and the importance of promoting the health of our workers. So ayaw po natin magkasakit, lalong-lalo na ngayon, pandemic. We're really in a dire problem now because of the pandemic. Productivity is suffering. Marami pong hindi nakakapasok. So the income earning capacity of the workers are compromised. So napaka-importante, hopefully while waiting for a better opportunity, we welcome you to this kind of seminar, KamOSHtahan. Hopefully with a limited time, you are able to apply all the knowledge in order to safeguard and to ensure that the workplace is always safe. So lagi po natin tandaan, the objective of this training is to prevent or eliminate injuries, to prevent and eliminate illnesses to happen in the workplace. And hopefully, I'm inviting everyone, if you have never been to a safety officer training, mga kapatid, meron po tayong SO1 trainings, one-day training, meron din tayong 40 hours training. Feel free, I'm inviting you to visit our website to learn more about the schedules being offered by our safety, Occupational Safety and Health Center. Just feel free to visit us, and hopefully you join us in our number of future trainings. The requirement for the Department of Labor and Employment now is for you to have a safety officer in all workplaces now, regardless of size, regardless of classification, whether it's high risk or highly hazardous establishment. We welcome the initiative given to us by our REUs for providing this special knowledge. And hopefully this will not be the first and the last. And I'm also encouraging our other REUs to continue working hard. Lahat po ng REU natin, let's focus on providing free SO1 trainings and free KamOSHtahan seminars. So napaka-importante po ngayon. We're now reaching out to the informal sector. We are now reaching out to the most marginalized sector of the society through giving is free mandatory trainings. So kaya na po natin abutin ang ating mga kababayan kahit yung mga nasa abroad who are now working abroad, who have left behind their families. Hopefully, we can reach out to them via this webinar. And I hope this is linked to Facebook. Napaka-importante nito, Melvin, that it is linked to our Facebook account so that it can be viewed in all parts of the world. Truly, I've been hearing a lot of positive remarks from our stakeholders for our initiative to conduct KamOSHtahan. Napaka-importante. This is now currently running at episode 3, just like in any television series. Meron kang season 1, Netflix, season 2, Netflix. Maaring ganyan kung makakarating tayo ng season 5 sa ating KamOSHtahan. So ating mga kapatid, I'm encouraging you to join SO1 trainings, SO2 training, COSH, BOSS, and hopefully you will become an accredited practitioner and consultant. Ako po ngayon nasa Isabela to help in the operation of the relief operation because mga karamihan mga kababayan natin dito have suffered a lot and they now, although the water have receded, but there's still a lot of problems, especially on the economic problems confronting them. They don't have any means to survive. So, pagdasal po natin sila, ipagdasal natin ang ating mga kababayan, less fortunate kababayan who have been affected by this flooding. So, napaka-importante po yan. And to you mga kapatid, enjoy the day, enjoy being with us, especially with our REU6, Melvin. Very creative si Melvin. Pwede na siyang ipalit kay Wawawi. Pwede na natin siyang gumawa ng programa ni Wawawi. To all of you, mabuhay po. Remain healthy, remain safe during this pandemic period. And hopefully, together, we are able to survive this crisis. All of us, sama-sama, ang sabi nila, walang iwanan. Nobody will be left behind. Thank you very much.
Thank you very much, Executive Director Noel C. Binag, for kind welcome remarks. Always, ever supportive po dito sa Region 6. Thank you very much, sir. Now let us be inspired and be driven with passion by an inspirational message from the head of the Dole Regional Office 6. Ladies and gentlemen, proudly Ilonggo, Regional Director Cyril L. Ticao via a video presentation.
Good morning, everybody. First of all, I would like to express my gratitude to the Occupational Safety and Health Center, headed by, of course, by their ever dynamic Executive Director, Noel Binag, for this initiative. In this trying time, the government is still trying its best to extend its assistance, and this Occupational Safety and Health session via webinar is a concrete example. We must still continue to educate our stakeholders on the importance of occupational safety and health, even in the new normal condition. It is because safety cannot be compromised, especially in this time. Let me also thank all the participating companies and organizations who participated here today. The public information campaign is very timely. I believe that for us to develop safety and health advocates, we should always start from making people aware of the importance of these practices in the workplace. In this gathering, you will have the opportunity to learn from our speakers and learn from the best practices in the industry. In the year 2018, marked a historic event for the safety practitioners and advocates because of the passing of Republic Act 11058, or the Act strengthening compliance with occupational safety and health standards and providing penalties for violation thereof. This law is a manifestation that the safety of our workers in their workplace is of great importance. We also recognize in the department that our vision for a safe workplace for all workers could not be achieved without your cooperation and help. This vision and goal will take more than just our effort. We have to be united, and with this kind of gathering, we are one step closer to that goal. On our end, we are currently in partnership with DTI in conducting monitoring of establishment in compliance with the interim guidelines of DTI and the Department of Labor and Employment on workplace prevention and control of COVID-19. This is to protect our workers from contracting the virus when they are at work. We make sure that every worker is protected from unsafe practices. Again, we do not compromise. And with this advocacy campaign, it is our hope that you will walk out from this venue with the passion to promote safety and health in your workplace. We hope that you commit and improve your policies, especially about the health issues that will be discussed in this training. So with that, I would like to once again thank everyone. Your presence here today shows your desire and commitment to your respective organization. After all, we are bound by our commitment to serve. We are here for a greater goal, and that is for every worker to have a safe workplace. Mabuhay ang mga gagawang Pilipino. Maraming salamat.
Thank you very much, Dole Regional Director Cyril L. Ticao, for your inspirational message. Now at this time, I call on Mr. Junel John Moleño, our Regional Public Information Staff, to acknowledge the participating organizations who are with us right now.
Hi, good morning, everyone. I have the privilege to acknowledge the participating organizations who are with us right now. Let me acknowledge my coworkers from the Occupational Safety and Health Center, the dynamic REU representatives throughout the country, my Dole family members, my fellow public servants from various government agencies, the Western Visayas Occupational Safety and Health, the Safety Organization of Negros Occidental Incorporated, the Boracay OSH Network, Tri-Safety, Courtyard by Marriott Iloilo, Shawking, Shakey's Haro, Mang Inasal, Pepper Lunch, Zark's Burger, Jim's Recipe, Jolly Management Solutions Incorporated, Lechon House Food Corporation, Pepsi Cola Product Philippines, Goldilocks, Rastan Coffee Corporation, Bistro Carcosa, San Jose Bake Shop, Yam Chow Restaurant, Crave Food House, Bread of Life Keto Pastries, Hotel Del Rio, MPA Hotel and Resorts Incorporated, Sicogon Town Hotel Incorporated, Iloilo La Festa Hotel, Green Sun Hotel, owners and safety officers, HR managers, company representatives, OSH champions, and advocates who are online right now. Thank you very much for your active support and participation.
All right, thank you, Sir Junel. Now we move on to the session objectives, wherein now at the end of the 2.5 webinar session, participants will be able to, number one, recognize industry-specific OSH guidelines. Number two, compare industry-specific OSH compliance guidelines versus current workplace scenario. Number three, identify challenges in the workplace on OSH compliance. Then number four, note industry-specific best practices on OSH. Now, in order to make this session a success, may we please ask for cooperation regarding our session rules, wherein number one, please be courteous to everyone. Number two, stay on mute if you're not talking. Number three, do not use the meeting chat box for conversations not related to the session. Number four, all questions and clarifications will be answered during the Q&A segment. Number five, if you will experience any technical issues, please inform the facilitators via the chat box. Then number 6, a certificate of participation will be provided for registered participants who successfully submitted the post-activity evaluation forms. Now moving on, we proceed to the first topic for today. This will be a 30-minute topic on OSH compliance and guidelines in the food and beverage industry. Now our resource person is a licensed chemical engineer who has been with Modernization Corporation for 10 years as a QC head. Also, 5 years of experience as an industrial hygienist 3 of the Occupational Safety and Health Center. Also, a previous senior OSH inspection officer under the OSH section of the Public Health and Safety Department of Dubai Municipality in Dubai, United Arab Emirates in 4 years. Now, currently, she's the Regional Program Manager of the Occupational Safety and Health Center Regional Extension Unit number 8. Ladies and gentlemen, please help me welcome Engineer Maria Elena L. Diaz. Engineer?
Sir Max, good morning. Thank you so much, Sir Melvin Melocotan, for that kind introduction, heartwarming introduction. So, to our 188 participants, a pleasant morning to everyone. To our beloved regional extension units who are here today. Okay, so good morning to everyone. I'm sorry, I just came in. Am I supposed to start my presentation already, Sir Melvin?
Yes po, ma'am. You may
Okay,
start.
my apology for that. I had my personal break, okay, before the start of the session. Anyway, now allow me to share with you my presentation. Okay, so again, good morning, everyone. Good morning, of course, to our Executive Director, Noel Sibinag, and the heads of the regional extension units. Good morning. Our participants who are here today, once again, good morning. So thank you so much for inviting us, Sir Melvin, Region 8, to be your resource speaker on the OSH compliance and guidelines in the food and beverage industry. So today I will be discussing with you with the OSH indicators. What are the things that we need to consider, okay, when we talk about the compliance of the food and beverage industry to the requirements on occupational safety and health? So first thing foremost, we have to determine who are the food and beverage industry. So basically, as defined, the food and beverage industry are industries involved in processing raw food materials, packaging, and distributing them. This includes fresh, prepared foods, as well as packaged foods, and alcoholic and non-alcoholic beverage. So I believe most of our participants here today comes from this particular industry. So any product meant for human consumption aside from pharmaceuticals. So they are considered to be part of the food and beverage industry. So what are the requirements that are specific for the food and beverage? So you might be wondering, is there a specific requirement just for the food and beverage industry when we talk about occupational safety and health? So the food and beverage industry, same with other industries actually, they shall comply with the requirements of the Republic Act 11058, also known as the Act Strengthening the Compliance of the Occupational Safety and Health Standard and providing penalties thereof. And of course, it's implementing rules and regulations, or the DOLE, Department Order number 198 series of 2018. Now, every industry have its own peculiarities. Iba-iba po yung mga hazards, iba-iba pa yung mga risk that the workers are being exposed to in a food and beverage industry. It doesn't mean that they have the same, for example, they are the same bottling companies. They already have the same hazards. No, they have different hazards and different level of exposure. So the risk also varies. So there are no two industries that are actually totally the same. So hazards and risk of each industry differs. Thus, the policy and programs are also in variations. So we will be talking about this. So some of these indicators that I'll be discussing today might not be applicable to you, but you have to check whichever indicators will be applicable to your organization. Because as I mentioned, it varies from one organization to the other. So today, we will be discussing the different indicators that you should look into, not just for compliance. So na-mention po kanina ng executive director natin that it's not about compliance on safety and health, but we ultimately want to ensure that our workers are always safe. So we want to ensure that there will be zero accident in the workplaces, as well as zero work-related illnesses. So therefore, there is a need for us to ensure that our workplaces are always safe and our workforce are always safe and healthy. So we will be discussing the OSH indicators. The first is, this is mandatory, of course, to all establishments, regardless of the number of workers. So first, you have to make sure that you have the registration of your establishment per Rule 1020. Okay, so first thing, your employer shall register his business to DOLE so that your organization or your establishment should form part of a data bank of all concerned establishments or covered establishment, I mean. Now, registration must be done it must be done 30 days prior its operation. So, hindi pa man nag-start yung operation natin, okay? So, dapat na-rehistro na natin ang establishmento natin sa DOLE. Now, the requirements, all you have to do is just check DOLE website, look for the Rule 1020 registration form. You have to fill it up. All forms are downloadable from all DOLE websites. Together with it, you have to attach the layout of your workplace. Okay, so the floor by floor layout of your workplace, showing all physical features of the workplace, including the storage, exits, the aisles, machineries, emergency devices, and locations of these devices. So it should be there in your floor plan. And it should be a scale of 1:100 meters. So it can either be in white or blueprint. And you have to attach also your copy of a business permit. Now, this particular registration is free of charge. So don't worry, you have to register and wala pong bayad ang magparehistro. So pinakauna po yung requirement natin para lahat ng programa ng DOLE ay kasama po kayo sa ating mga sa database natin for all covered establishment. So yan yung unang requirement natin to check for the OSH compliance indicators. The next thing for us to consider is to check if we have the OSH policy. Okay, so we call it also the company commitment. So you should have a written company commitment, your employer's commitment to comply with the occupational safety and health requirements, or the written statement by the employer now stating the company's commitment, okay, for the protection of the health and safety of employees and to the public as well, also known as the company's OSH policy statement. So marami sa ating alam na policy statement po yon. Okay, so that's the company commitment. Because if there's no company commitment, the commitment of the company, hindi po magagawa lang ang mga programa ng isang establishment or ng company if there's no commitment coming from the employer themselves. Okay, so a written occupational safety and health policy actually helps promote an effective OSH program. Such a policy should reflect the special needs. So ano ba yung mga special needs in your establishment, in your company, in your workplace? And should be regularly reviewed and updated. So minimum for this, you can do your review once a year or as deemed necessary. So this communicates a commitment to health and safety and should be signed by the highest ranking official in your company, di ba? So dapat yung pinakamataas na official in your company, siya pong mag-signify his commitment that they are committed or the organization is committed to protect the workers at all cost, okay, in terms of safety and health. So that's it for our second OSH compliance indicator for your OSH policy statement. So check mga kababayan kung meron na ba kayong policy statement. Kung wala pa, well then I think it's not too late to start writing one. The next we have the general safety health programs. So kailangan po lahat ng establishmento ay may mga programa on safety and health. So first thing is you have your HIRAC or the hazard identification, risk assessment, and control. Now, all establishments are required to have this and should be submitted to DOLE. Now, the conduct of the hazard identification, risk assessment, and control is very essential in the prevention of accident and illnesses in the workplace. Okay, it will determine what hazards are present at the workplace. Okay, gaya ng food manufacturing industries, the beverage industry, ano ba yung mga hazards na present in your workplace? So you have to determine what are these hazards. And once identified, you have to establish control measures. So these controls of exposure to this hazards should be detailed in your safety and health program. So lahat po ng mga hazards, kaya kailangan po well-versed po ang mga personnel who conducts the hazard identification because that is the very essential part also in doing the HIRAC. You have to determine the right hazards for you to be able to implement the right control measures towards those hazards. Now, this will help you also in the determination of your company's risk classification, di ba? It is the responsibility of the company to do their own to determine their own risk classification. So ano ba kayo? Are you low risk? Are you medium risk? Or are you a high risk? So yan po ang gamit din ng HIRAC, okay? It is important for us to know the risk classification for a company because there are numerous requirements that needs the information of the risk classification. Example, you need to know what is your risk classification if you want to know how many safety officers are required in your organization. You need to know how many occupational health personnel. So one of the criteria to determine on the requirement for safety officer and occupational health personnel is you have to determine the risk classification of your establishment. So very important po yung HIRAC, ang pag-conduct ng HIRAC sa workplaces natin. That form part of your general safety and health programs. So of course, aside from HIRAC, you also have to conduct the medical surveillance. Now, for optimizing employees' health, this is also to detect and eliminate underlying causes such as hazards or exposure of any discovered trends, okay? And thus have a prevention focus. So conduct natin, ano ba yung mga prevalent mga illnesses in our workplaces? Because it varies from one industry to the other because you have peculiarities, you have different hazards, you have different equipments, you have different layouts. So most likely, you have different hazards and exposures. So in this, the conduct of physical examination also are required. So we know that examinations such as pre-employment is mandatory, is required. Your periodic annual examinations is also required. So pwede po yun annually, at least once a year ang required dito, magkaroon ng physical examination and other examinations depending on the risk involved in the workplace. So depende, meron tayong, like for example, if you have exposure to lead, meron tayong mga special examination for the blood lead. Okay? So depende po kung ano yung mga exposures ng workers natin. There are other special examinations that is required for your workers to undergo. And that is part of your medical surveillance also. So on top of that, pwede po din po tayo, may required po tayo na mag-conduct po tayo ng random drug testing for the establishment. Later on, I'll be discussing with you that there is also a requirement for you to have a policy and program on drug-free workplace. But this one on it states that you have to have drug testing for establishments, especially for those establishments that have greater than 10 workers. So yun po nakalagay pag 10 and more workers, mandatory po na meron tayong mga kinakandak na random drug testing para sa establishment natin. So sabi na, why do we have to conduct random drug testing? Because, there are accident that happens in the workplace that is actually linked to workers who are under the influence of drugs, di ba? O prohibited drugs. So that's the reason why we have to do this also, because this is a prevention aspect when we talk about occupational safety and health. Now, for the requirement of your first aid emergency medical services, so meron tayong one requirement is for you to have the medicine cabinet or the medicines. So for you to know ano bang mga medicines na kailangan namin sa workplace namin. Now, this requirement also depends on the number of workers that you have. Okay, so you can refer this to table 47 of the list of medicines in our occupational safety and health standard. So first aid, ano ba mga first aid facilities ang kailangan natin? So later on, i-discuss din natin yan kung ano-ano mga facilities requirement as part of your OSH compliance. Okay? So next is we have the requirement of the policy and program on the promotion of drug-free, or as mentioned kanina, policy and program on the promotion on drug-free workplace. Okay, so this is actually pursuant to DOLE Department Order Number 53, Series of 2003, known as the Guidelines for the Implementation of Drug-Free Workplace Policies and Program for the Private Sector. Now, this is actually mandatory to all establishments with more than 10 workers. Else, if less, it is only encouraged. So yung mga workplaces na mayroon less than 10 workers, okay, you don't have to have a written policy on the drug-free workplace, okay, but you are encouraged to have a written one. Okay, so your policy should include advocacy. Okay, you have to inform your workers what are the ill health effects of drugs. Okay, effects to the workers, effect to other workers, ano epekto sa trabaho. Okay, you have to do education and training. You have to conduct the random drug testing. And meron tayong kung sakaling nagkaroon ng positive, meron tayong mga treatment, ano ba, paano natin gagawin, paano natin i-assist si worker on the treatment and rehabilitation. And of course, you should have your referral system also. Okay? So next is we have the mental health. Ito bago lang po to, di ba? Just this 2020 na-release po yung implementing rules and regulations as well as yung DOLE Department Order Number 208 Series of 2020 nga. It is the guidelines for the implementation of the mental health workplace policies and programs for the private sector. So actually mandatory ito sa lahat ng mga establishmento. So lalo na ngayon sa panahon ng pandemya. Okay, so we have to be very keen. Okay, dahil po marami pong affected na in terms of their mental health, affected din because of this COVID-19. So we have to make sure that we are also compliant with DOLE Department Order Number 208. Okay? So, and of course, we have to promote healthy lifestyle among our workers. Okay, so yung mga exercises, that's very good. Having Zumba every day in your workplace or providing facilities for them to exercise, that is good also. And conduct of training also. You have to inform your workers that there are certain lifestyle, okay, so that is not good for our workers. Next is policy and program on the prevention and control of HIV and AIDS, tuberculosis, hepatitis B. Now, the prevention and control of HIV and AIDS pursuant to DOLE Department Order 102, Series of 2010. And of course, this is in accordance with Republic Act 8504. Now, this particular policy and program or prevention and control should form part of your OSH program. Diba yung OSH program natin, we need to have our own occupational safety and health program, and this program should be submitted to DOLE. Dapat po lahat ng establishmento ay sinasubmit yung OSH program nila sa DOLE. So part po ng program natin is your policy and program on the prevention and control of HIV and AIDS. So makita po niyo doon sa department order kung ano bang kailangan mga components doon sa program natin. And of course, our policy and program on the prevention and control of tuberculosis, pursuant naman ito sa Department Order number 73, series of 2005. Now, your TB prevention program shall contain the prevention treatment, rehabilitation, compensation, restoration to work, and social policies. Kasi marami po tayong mga workers nagkaroon ng TB, tapos po nagkakaroon ng discrimination sa workplaces nila. And that should not be the case. Hindi bawal po tayo mag-discriminate ng mga workers kahit po sila ay may TB. So dapat mayroon tayong mga programa na written policies and programs on this. Next, of course, is we have hepatitis B policy. So pursuant naman po sa DOLE Department Advisory number 5, series of 2010. So sasabihin nyo, hindi to prevalent sa workplace namin because hepatitis B is, I believe it's blood-to-blood yung transmission natin. Okay? So, pero under the OSH requirement, lahat po ng establishmento are required to have their policy and program on the prevention and control of hepatitis B. Okay, so because you know what, many job applicants, kung narinig nyo na, may mga applicants who are, sad to say, became positive with HB, yung antigen testing nila, naging positive, and they are already declared unfit to work. Okay, without appropriate medical evaluation and counseling. Now, and these individuals are otherwise healthy and can be gainfully employed. So instituting this policy should eliminate the discrimination against HEPA positive workers. Okay, so hindi natin kailangan, and this should not be a reason to terminate a worker. Okay, these 3 policies and programs, this will be, kahit naging positive ang worker natin sa HIV and AIDS, TB, hepatitis B, these are not grounds for termination. Okay? So let's check kung meron ba tayong policy and program on the prevention and control of this particular aspect sa health natin. Next, on your OSH, number 6 on our OSH compliance indicators is we have the composition of your OSH committee. So meron tayong requirement na dapat meron tayong Occupational Safety and Health Committee. So i-organize natin yung committee natin. This is in accordance naman dun sa Section 13 sa OSH law natin. So the OSH committee shall effectively plan, develop, and oversee them and monitor the implementation of your OSH program. So sila po nagplaplano lahat ng mga programa niyo sa safety and health at nag-evaluate kung effective ba yung mga programs natin. So mayroon po tayong requirement depending on the type of establishment, yung risk classification natin. So kaya sabi ko, it is deemed necessary that you have to classify your establishment according to its risk. Ano ba yung establishmento ninyo? Low risk, medium risk, high risk. Because kung pag-uusapan natin on the composition of OSH committee, one of the criteria that you have to consider is the classification of your establishment. Okay, I'll give you an example. For example, establishment with less than 10 workers and low risk establishment with 10 to 50 workers, meron po tayong sinasabi, ito sa category A natin, okay? So meron tayong requirement that it should be composed of a chairperson, secretary, and the member. So secretary should be the safety officer, but of course for this type of establishment, so mga maliliit lang, less than 10 workers, the safety officer of the workplace may also be the owner or the manager or his designated representative. Okay? So ito naman sa B, so karamihan po sa mga manufacturing industries, I think they belong dito sa B. Okay, lalo na yung mga food industries, marami po tayong mga workers, and usually food industries and beverage industries, they fall under medium to high risk. Okay? So we have to check kung ano ba yung classification at ilan yung workers natin to determine kung anong klaseng what type of OSH committee should we need. So for type B, we have ex officio chairperson. This should be the highest ranking authority. Then we also have your first aider, and you have your ex officio members, yung occupational health nurse, your dentist, your physicians, and of course member of your yung worker as member. Okay? So ito, check natin po kung meron tayo nito. The next is we have the requirement for OSH personnel and facilities. Mind you, we have to look into this because the new law, meron na po tayong penalties, monetary sanctions po. So meron pong involved na yung penalty natin ngayon sa OSH law natin. So you have to be very careful and you have to check that you are indeed compliant. Okay, so OSH personnel and facilities, so kailangan meron po tayong safety officers, so meron po tayong of course, yung safety officer natin, dapat may training. So just check doon sa table natin sa Department Order 198 kung ano ba, ilan bang safety officer ang kailangan sa workplace ninyo. Okay? And yung safety officer nyo should have the training. So ika nga, dapat competent yung safety officer natin. Okay? So and meets the minimum requirement to be a safety officer. So i-designate siya ng employer. Okay, and of course your occupational health personnel, kung kailangan ba first aider lang or kailangan ng occupational health nurse, occupational physician, or occupational dentist. So you have to determine this for you to be able to check if you are compliant with the requirements on occupational safety and health. Now, for your health facilities, check nyo. Okay, so dapat meron tayong mga emergency medicines. So sabi ko na kanina, meron tayong table 47. You have to refer there para malaman nyo kung ano ba yung contents ng mga first aid kits natin or first aid boxes natin. Then you should have your treatment room. So this one, it will vary kung ano bang required sa inyo. What is required for you? Is it just a treatment room? Or do you need to have a clinic, a hospital, and of course the requirement for a dental clinic? Okay. So next is we have the safety and health promotion, the training and education. So are you compliant with the requirement on the orientation of all your workers? So ito sa number 8 natin. So the 8 hours OSH orientation of all workers, it should be conducted by the company's safety officer or by any certified OSH practitioner or consultant. Other specialized training. So on top of the 8 hours training, that is mandatory for all workers, irregardless kung ano yung trabaho nila sa workplace ninyo. So there are also specialized training that are required that shall be conducted if applicable in the food manufacturing industries that have, example, mga food manufacturing industries, they have these chemicals, different chemicals. So if you have chemicals in your workplace, so you have to conduct safety on the use of chemicals in the workplace for those who handles chemicals. And that should be in place. Okay. Another is in the manufacturing of alcoholic beverages who have storage tanks, di ba? If you have seen alcoholic beverage manufacturing industries, they have large tanks, silos for the storage of the raw materials, and these are considered as confined spaces. There are times that these confined spaces, okay, nagtatrabaho dito yung mga workers natin. Okay, special work, special activity such as maintenance, welding, okay? So kung may mga kailangan gawin inside those confined spaces. So for those workers who might be exposed to such workspaces, okay, they shall have a special training on confined space entry. Okay, so of course, before you have the training, may requirement din po tayo that you have the program on your confined space entry program. Okay, so mama, i-discuss din natin a portion of that. And of course, other training shall be conducted depending on the activities. So sabi ko, it varies from one organization or company to company. So kung ano ba yung mga hazards meron dun, hazards on the equipment, what equipments you have, okay, pressurized vessels that you have that could pose risk to your workers. So you have to conduct special training for those workers who will be affected by this or who are exposed to this particular equipments. So it's necessary that you have to identify this. So appropriate training should be given to them. So another, in addition to the mandatory training for your OSH personnel, is the requirement for a continuous training. So meron tayong mga continuous training na kailangan. Okay, so example is the 8 hours refresher course training for your occupational health personnel, which is mandatory at least once a year. So hindi porket tapos na kayo sa 40 hours mandatory training for safety officer or the 50 hours training. Actually, it's just 40 hours training, but ONAP is conducting it for 50 hours training for the occupational health nurse. And I think it's 68 hours, I forgot, okay, for the occupational position. So there is also a requirement that you have to do refresher courses. So at least 8 hours training in a year on top of those mandatory trainings. So if you also have works that deals with hazardous energies and hazardous processes, the need for a work permitting system should also be there. Okay? So kailangan po natin i-check kung ano yung mga permitting system na kailangan sa workplace natin. For example, if your company is doing some hot works, so dapat meron tayong permitting system on that particular activity. And your workers should be educated, meaning to say, they should be informed on the system. Alam nila kung anong mga gagawin, alam nila kung ano ang kailangang gagawin. Okay? So you have to make sure that you have this. Number 9, of course, you have to conduct safety meetings. This is on top of the meetings that the OSH committee is conducting at least once a month. Okay, so meron din tayong mga meetings required for the OSH committee to conduct at least once a month. Recorded din po lahat ng meetings nila. Okay, so actually for manufacturing industries, we do not call that toolbox meeting, but that is interchangeably with safety meetings. Pwede po natin tawagin yan toolbox meeting if you want to. So at the start of your work, you can do a short meeting, a short discussion on the things that you're going to do. Now, this comes in also especially if there are activities na hindi siya routinary. Okay, so ngayon lang namin gagawin. Like example for maintenance of your equipments and machineries. So before the start of the work, you have to conduct safety meetings. And all these meetings should be recorded. Okay, so may record po tayo, may minutes of the meeting tayo para i-check natin kung ano yung mga na-discuss natin, ano yung mga napag-agree natin. Okay? So you have to determine also the frequency, the duration of your safety meetings. Okay? So next is we have to check if you are compliant also is on the reportorial requirements for number 10. There are OSH reports. This report should be submitted to DOLE. Okay? So meron tayong mga reports na reports on the Safety and Health Organization. Actually, your Safety and Health Organization, that should form part of your OSH program. Kasama dun yun sa format natin that you have to put on the organization of your health and safety. So, recommended po that every year you have to reorganize. Okay, only for the members because there are some members of the OSH committee that cannot be replaced, okay? So mga ex-officio members. So one reportorial requirements that is mandatory is what we call the annual medical report or the AMR. So this must be submitted on the last day of March or March 31. Okay, so yung isasubmit natin po yan sa DOLE. Okay, next is we have, actually, the good thing about the submission of these reports, meron na po tayong online submissions. So you just go and check with the website of the Bureau of Working Conditions. Meron po tayong doon kung saan pwede kayo mag-submit ng mga reports ninyo. Of course, if you want, you can also submit to the department, AMR, sino bang dapat mag-fill up ng AMR natin? As much as possible, we recommend that it should be filled up by the occupational health personnel. Okay, so sila po dapat ang mag-fill up. But of course, pwede din po si safety officer kung may knowledge and training naman si safety officer. Another reportorial requirement is your work accident injury report. So to be submitted for work-related cases resulting to disabling injuries or conditions. So alam na yan ng mga safety officers when we say disabling injuries or conditions, these are accidents that result to at least one day, one lost time, okay? Lost day, I mean. So meron nag-absent si worker ng isang araw, buong araw, dulot ng aksidente. Okay? So these are considered as disabling injuries. So these reports should be submitted on the 20th date of the following date of the accident, following month of the date of the accident. Okay? So, what year naman, mayroon tayong additional for your what year, which is the COVID-19. Okay, so I just remember this one. Okay, so I'm sorry I wasn't able to add this on my presentation. We have the what year COVID-19. I hope you are complying with this already because it has started already. So this submission is every end of the month. Now, the what year form, the what year COVID-19 should be submitted to DOLE with or without COVID cases. So remember to submit it every end of the month. Ito yung additional natin sa reportorial requirement for your OSH reports recently being added. And of course, your annual exposure data report. So you have to check, kayo ba may report na sa annual exposure data report ninyo, which should be submitted on the 30th of January. Okay? So lahat po ng mga occurrences of accidents and illnesses in your workplace should be reported. Dito po sa AEDR, kailangan po natin isulat yung severity rate and the frequency rate. Okay? So safety officers, I know you are well versed in computing for this severity rates and the frequency rates. So dito po yun doon sa AEDR natin, nilalagay natin yung mga indicators natin. Okay, next is the provision of personal protective equipment. So ang company nyo ba ay compliant to this? Thus your company gives free personal protective equipment for those who are exposed to the hazard. So the employer shall provide necessary PPE to all workers who have exposure to the hazard and should be free of charge. You should ensure that all PPE should be of approved design and materials, appropriate for the exposure and the work to be performed. So marami po tayong mga different types, different classes of PPEs. So you have to determine what are the hazards and what is the appropriate PPE for that matter. So the company should also have a policy and program on the provision, on the use, and the maintenance of the PPE. Hindi po yan porket bumili na si employer ng PPE, bigay na lang agad kay worker. No, you have to make sure that you also have the policy and program on the PPE, lalo na on the safe use and maintenance of this personal protective equipment. So you have to check if you have your policies already on the provision of personal protective equipment. Next is, do you have the provision of safety signages in your workplace? Meron ba kayo yung mga minimum requirements? Visible ba ang mga signages natin? Understandable ba sa lahat ng mga workers natin yung mga signages? So if you want to be strict on the size of your signages, you can go ahead and check our, you check table 2 of the Occupational Safety and Health Standard po. Nandun po ang standard colors of signs and safety instructions and warnings na kailangan sa mga premises natin. So nandun din po yung color. Okay, so you have to compute for the size of the signages if you really want to be strict on the implementation of your safety signages. Okay? Of course, nandun din po ang angkop na color of your signages. So check your workplaces, kung may mga hazards kayo, mayroon ba tayong mga warning signs na nakalagay doon sa mga hazards, doon sa mga areas that need to be taken into consideration na dapat mayroon tayong mga precautions. Number 13, may provisions ba kayo for workers' welfare facilities? So check nyo. So dito, adequate supply of safe drinking water. I heard this last time na mayroong mga employers nagbibigay daw ng free water na piso-piso. And that is not for free. Diba? You have to pay 1 pesos yung mga piso ano natin. Okay, so I hope hindi ganyan mga employers natin. Dapat po libre po. Surely, sa mga beverage industry, these are for free. Ang dami nila nito. So, libre po. Okay, so walang question dyan. Even yung mga bottling soda companies, I think they also give free sodas. But of course, that is not part of the requirement. The only requirement is adequate supply safe drinking water. Okay, so with facilities, ito naman, so adequate sanitary and washing facilities. You should have living accommodations. Now, these living accommodations, if applicable only. Okay? So, usually, ito yung mga sa call center agent sa call center industries. So separate sanitary, washing, and sleeping facilities kung applicable lang sa inyo. Okay? So, and of course, the requirement for lactation station. Now, with facilities, meron siya sa lactation station, dapat meron siyang ref or cooler, may table and chairs, may sink with running water or washing facilities. Okay, so allowing there should be a paid lactation break. So dapat may policy kayo, okay, on this. Kasi yung lactation break na binibigay natin sa worker natin, which should not be less than 40 minutes for every 8 hours, okay? So this should be paid break po ito. Okay, so observe lactation equivalency for establishment with peculiar circumstances. Ito naman, minsan kasi wala tayong mga enough spaces. So you check yung issued by DOLE on the lactation equivalency, kung ano bang pwede i-implement nyo. Else, meron din po tayo na pwede po kayo mag-secure ng exemption certificate. Okay? So, exemption certificate from DOLE pursuant to Department Order 143. Kung, say for example, wala kaming worker na babae, ma'am, so that is justifiable that there's no need for you to have the lactation station. But you have to secure an exemption certificate from DOLE, okay, pursuant to Department Order 143. Okay, so that's it for your workers' welfare facilities. Then you have to conduct your emergency drills. Mandatory po, meron po tayong mga drills. Just, I think last week, there was a nationwide na earthquake drill. Sad to say, naging reality yun sa Cagayan de Oro City. During the time of the drill, naging actual po siya, hindi po siya naging drill. Okay, so kasi nagkaroon talaga ng earthquake sa Cagayan de Oro. And this is very important for us to have these drills. Okay, so drill should be conducted depending on the nature of your work and workplace and the potential emergencies. For example, you have bulk chemicals. Okay, you are storing chemicals in bulks. So there's a possibility that you have chemical spills, chemical explosions, if these chemicals are also flammable. So you have to make sure that you conduct drills for this specific potential emergencies in your workplace. Example, you also have boilers. Okay, boilers can explode. Okay, so you have to conduct a drill for this. So you have to check what specific potential emergencies that could occur in your workplace, and you have to conduct emergency drills for this. Okay? And this should may form part also on your emergency preparedness and response program. Okay? So yung mga emergency preparedness program natin and response. So parte po yun yung emergency drills natin. Then, of course, number 15, you check if you're compliant with fire protection on the requirement for equipment and facilities. Kayo ba may fire extinguishers? Angkop ba yung fire extinguishers natin? Okay? May mga classes yan, mga type, depending on the hazard in your workplace. What type of fire hazard you have in your workplace, you have to determine that for you to be able to determine what type of fire extinguishers you should have. And these fire extinguishers, ang nangyayari po kasi sa mga fire extinguishers, hindi na ini-inspect. Okay, mandatory po, mayroon po tayong inspection program for this, inspected monthly. Okay, so lahat po dapat ini-inspect natin monthly. And of course, during drills, kung pwede, i-check din po natin if all these are working. Your fire hoses, your fire detection devices, okay? But of course, not all establishment requires fire detection devices. Okay, so you just have to check also the requirement on the revised Fire Code of the Philippines. May mas detalye din po doon yung requirement natin when we talk about fire protections. Okay? So, for exits, at least required po per floor area na meron tayong 2 fire exits. Okay? So, minimum po yan. But of course, it varies kung masyadong maliit naman yung workplace ninyo. So, 1 fire exit is enough. Okay? Now, next is we have the requirement for the compliance on the permit to operate for your industrial machines. So check nyo, lalo na sa mga manufacturing industries natin. Okay, so sa mga food and beverage, mayroon tayong mga boilers. Those who are using steam as their source for energy in their processes. Okay, so you use steam for your ovens or other machineries. So you use this as source of energy. Okay, so you have to make sure that you have all your permits. And because these are bound, they have the requirement for a technical safety inspection for this at least once a year. So you have to make sure that updated po yung mga safety inspections natin for this particular machines in our workplaces. Kung meron po kayo, lalo na sa mga food and beverage na talagang meron po tayong ginagamit na mga boilers, pressure vessels, okay? So pressure vessels required din po also that it should be, meron po tayong technical safety inspection for that. So, example for these pressure vessels, kung meron kayong mga bulk liquids, lalo na yung mga hot liquids, corrosive liquids, or corrosive chemicals under pressure, like ammonia, if you have ammonia, which are sometimes under pressure. Okay, so you have your vapors and other gases. Okay, so these are usually stored more than 15 psi. So another is for your combustion engines, kung meron kayong mga combustion engines that uses fuels, your elevators, okay, piping lines, crane and hoist, usually mga manufacturing industries na mayroong malalaking mga warehouses, they have these lifting equipments. Okay, for para wala pong manual handling. Okay, they also, and of course, you have to check your electrical wiring installation inspection. Okay, so ito po yung mga necessary to check if you are compliant on the requirement for occupational safety and health. Okay. Next is, do you have a program on good housekeeping? Alam nyo, marami pong mga aksidente nangyayari because of poor housekeeping. And yet, housekeeping is a very simple program, sabi nila, but very difficult to maintain, to sustain. Okay? So you have to make sure that your program on 5S is in place and all these programs are implemented. Okay, you evaluate, you monitor the implementation and the efficiency of this or effectiveness of this program on the housekeeping. Okay, so you may refer also to Rule 1060 for the tools on housekeeping. Okay. So number 18 is, this should be number 19. Apology for the incorrect numbering. Okay, so number 19 is the proper handling and storage of materials. So we have actually the DOLE Department Order 1360 of 2014, also known as the Guidelines for the Implementation of Globally Harmonized System in the Chemical Safety Program. So kayo, kung may mga chemicals kayo wherein I'm sure lahat kayo ay meron because meron kayong mga sewage, water treatment, di ba? Sewage treatment plants, water treatment plants ninyo, and you are using chemicals for these treatments. So meaning to say, you have handling and storage of these chemicals. So you are required to comply with DO 136, yung implementation of the globally harmonized system. At dapat meron kayong chemical safety program. Okay, so lahat ng workers are informed about your program. They have the training about the safe use of chemicals in the workplace, lalo na yung mga exposed. So you have to ensure that properly labeled lahat ng chemicals, dating or markings on the areas wherein these are being stored, because you have to ensure also that these are properly stored. Okay, the storage condition requirements, should it be stored in a dry area, enclosed environment with ventilation? So you have to check. Okay, so you have to make sure that you have your chemical safety program for this matter. And part of your chemical safety program is the proper handling and storage of these materials. Okay. So number 19 is the requirement. Ito, karamihan po na-violate talaga to. Hindi po nagkakandak ng work environment measurement. But this is a requirement under Rule 1070, mind you, that all establishments, especially manufacturing industries, should undergo at least once a year work environment measurement. Why? You have to check what is the level of lightings in your workplace. What is the noise level in your area? Because for those noise level that exceeds the limits or within the action level, you have to make sure that you have your program, okay, your policies and programs on the prevention of induced hearing loss. You have to make sure that if you are using equipments that emits radiation, you have to have your radiation exposure control, proper ventilation. Okay? All workplaces required proper ventilation. Lalo na ngayon sa pandemya, di ba? Meron tayong specific doon sa guidelines, sa DTI, DOLE guidelines on the ventilation requirement in your workplaces and even on the buses or the transportation for the employees. Okay? So, and we have to maintain the airborne contaminants in our workplaces to ensure na workers natin are always safe. They are exposed to a safe working environment. So this is mandatory po at least once a year that you have to conduct your work environment measurement. Then, of course, number 20, you should have your procedures in performing hazardous work or work that deals with hazardous energies. Okay, so yung mga work, lalo na hazardous energies that are done in an underground tank. So hazardous energies, exposed kayo while inside a confined space. That is very important. So this is also in related to the mentioned earlier doon sa item 8 natin on the list of OSH compliance indicator that you have to formulate procedures or the programs if you have exposure to or you are using hazardous energies. Ano ba yung mga hazardous energies? Chemicals, okay? Hot liquids. Ito, mayroon silang mga hazardous energy. Electrical energy. Okay, electrical source. Mechanical energy. These are all hazardous energies that could possibly lead to accident and illnesses if there's no preventive control measures in place. Okay, so you have to make sure that you have procedures for this. Okay, and of course, work permit system. Okay, so kanina I have mentioned about this, about the training of your workers, that if you have your work permit system, you have to ensure that your workers are being educated. They are informed about your system. Otherwise, there will be a failure on the implementation of your work permit system if the workers themselves are not informed, are not educated on the system that you have. Now, this defined procedure, you may check also Rule 1120 of the standard for hazardous workplaces, okay, or work processes. So you have to check if there is a need for you to do your work permit system, especially for workers or workplaces na meron kayong mga hot works or yung mga sa nagkakandak ng mga maintenance of big machineries. Okay, so pag nagkanda kayo ng maintenance ng mga malalaking equipments ninyo, you have to make sure na mayroon kayong work permit system kasi mayroon yan mga hazardous energies. Okay, so you have to ensure that meron tayong procedures, meron tayong programa to ensure the safety and health of our workers. So kasama na dito yung mga lockout, tagout systems natin. Okay, so yung mga loto natin, isama na natin dito. So, and of course, last is we have others. So, ano pa yung mga iba na hindi ko na-mention? You can check if you are already compliant with the DTI DOLE. Ito yung bago natin, Supplemental Guidelines on the Workplace Prevention and Control of COVID-19. So, check also if you are compliant with all the requirements of these guidelines. And of course, for those manufacturing industries that are using steam, they have boilers, you have heat exchangers, you have processes that involve heat. Okay, so your workers might be exposed to heat stress. Okay, so you have to have your heat stress management. So check nyo, yung mga bakeries natin, yung malalaking ovens. Okay, so sa food manufacturing industries, your workers might be exposed to heat. So you should also have your heat stress management program in place, being practiced and implemented in your workplace. Check also if you have the exposure, your workers have exposure to prolonged standing. So you refer to Department Order 178, gumawa kayo ng programa Okay? Naaangkop doon sa Department Order 178 kung meron po tayong mga workers that who by nature of their work have to stand for a long period of time. So you check, you have to make your policy and program on this to ensure that you are compliant with DO 178. And of course, the other is the DO 184. If your workers naman, yung nature of work nila is they have to spend long period of hours sitting. Okay? So these are some of the new orders that are mandatory for establishments to have. So these are mandatory for food manufacturing industries and beverage industries. Okay? So those are the OSH indicators that you need to check in your workplaces if you are compliant to make sure that our workers are always safe and healthy. Okay, so that's it for the different OSH compliance indicator that you are required to comply as applicable. Okay, kung applicable lang po sa workplace ninyo. Okay, so the Occupational Safety and Health Center is with you in ensuring the safety, okay, and health of our workplaces and our workforces. Okay, so we're always just an email away, a text away if you need our assistance for you to be compliant with all the required occupational safety and health requirements. Okay, so lahat po tayo ay pwede maging OSH champions. Hashtag po ligtas ang maingat. Thank you and good morning everyone po.
Thank you very much, Engineer Diaz, for sharing your inputs and expertise and a comprehensive discussion on OSH compliance and guidelines in the food and beverage industry. Thank you very much, Mami Ellen. Can you please stay for some questions and clarifications later on from our audience during the Q&A segment?
Yes, Sir Melvin. Thank you.
Thank you rin po. Now, ladies and gentlemen, please once again remind everyone, if you're not talking po, can you please mute your Zoom application? Once again po, for those who are not permitted to speak, please mute your Zoom application or your account for a while. All right, thank you very much. Now we proceed to the second topic for this webinar session. This will also be a 30-minute topic on the best practices on OSH in the food and beverage industry. Now our resource person he is the Loss Prevention Manager of Courtyard by Marriott Iloilo. He graduated BSPMA class of 1994. He's also a member of the Philippine Society for Industrial Security Incorporated. He completed his basic occupational safety and health training in 2013 and loss control management and hazard identification risk assessment control in 2019. Ladies and gentlemen, please help me welcome Mr. Raul E. Fernandez.
Hello, everybody. Thank you, Jonel, for that introduction. So,
good morning, sir.
Hi, good morning. Kumusta po tayong lahat? Okay, so let me share my screen.
Ilang hours yan? Hanggang 12 na siya. Ito food beverage industry best practices. Kasi group ako ng ano nila sa REU6. Hinanap nga nila ko, bakit dito ka sa Davao?
Hello, can you show do you have a visual of my presentation, please?
Yes, sir, we have.
Yeah, okay. So once again, thank you. I would like to introduce myself again. My name is Raul Fernandez, and I am the designated safety officer of Courtyard by Marriott Iloilo. This is in conjunction of my other responsibilities as the loss prevention manager of the property. So we send you all greetings of peace and safety from the management and associates of Courtyard by Marriott Iloilo. Once again, thank you, Sir Melvin, for inviting us here in this webinar to share our experiences and best practices in dealing with the COVID-19 crisis. So let me first show you some background of our property. So our Courtyard in Iloilo is a Marriott managed hotel situated in Iloilo Business Park in Mandurriao, Iloilo City. It has three food beverage outlets catering to dining needs of our guests, located on the upper ground floor Adjacent to the lobby is the courtyard bar and lounge with a 60 seating capacity. And going further inside is our all-day dining restaurant, the runway kitchen with 120 seating capacity. And on the second floor, we have the pool bar, grill, and bar beside the pool with a 70 seating capacity. Just like other industry, Courtyard was not spared from the impact of the pandemic. Our associates suffered the same fate as others, psychologically, mentally, and financially. In the succeeding slides, I will be talking more on our total hotel approach in dealing with the crisis, since F&B is an integral part of the overall hotel operations. So for our total hotel approach, Marriott Price takes pride in its culture of putting people first ahead of any other considerations in running the business. This includes looking after the welfare of our associates and safety of our guests whenever they are inside our property. So they are our most valued treasures. So don't be surprised if I will be dwelling more on this subject in this presentation. In dealing with any emergency or crisis situation, nothing is more vital than having a written crisis management plan and or emergency response procedures, and actually prepare for it before it actually happens. Because of a past viral pandemic that Marriott experienced, as a SARS, foot and mouth disease, and others, pandemic response has been integrated into its crisis management plan. COVID-19 is said to be a novel or a new strain of coronavirus. That is why a lot of adjustment had to be made in our response procedures. In order to fine-tune those procedures, as we impart them to our ERT members, we did tabletop exercises, then tested those responses through drills. As early of this January of this year, we were already alerted of the emerging novel coronavirus or acute respiratory disease in Wuhan, China. Guidelines were simultaneously issued by the management to provide information about the virus and to give guidance on planning and prevention responses. At our level, local policies and procedures were made to address emergency cases specific to pandemic situation, such as guidelines on personal health protocol, medical response, quarantine procedure, access control, contact tracing procedure, and operations under a quarantine facility condition. Those are the product of accumulated guidelines and ordinances issued by the IATF, DOH, DOT, DOLE, and the city government of Iloilo. We actively tracked and monitored the constantly changing ordinances and procedures issued by those government agencies and made the necessary adjustment as the case may be. Consequently, information pertaining to COVID-19 and its prevention was constantly disseminated to all associates in various forms. Associates were required to attend orientation seminar on COVID-19 at the onset of the crisis to keep them abreast of the situation, to share procedures and protocol, and prevent spread of misinformation. This was proven effective in averting anxiety and misinformation from seeping through the minds of our associates, at the same time keeping their morale high. So aside from information sharing, associates were also encouraged to engage in physical activities such as running, yoga, Zumba, in order to boost their immune system. This, of course, was made before lockdown was announced in the city. So as to our associate welfare, to mitigate the impact of the pandemic, the hotel provided the following assistance to our associates: accommodation in the hotel of our skeletal force, and the work from home arrangement for back of the house staff, transportation provision for those trapped due to lockdown, creation of a group chat in Viber for in-house and on-leave associates to keep them updated of ordinances and policies, sickness and self-quarantine monitoring to check on their health, rental negotiations of associates with existing landlords to spare them from paying rental while on lockdown, facilitate medical teleconsultation of our sick associates with our accredited physician, and provision of financial assistance to those on leave without pay. So while our associates were put in lockdown, we had introduced some special projects and activities. So the following, no, so special, so that they will have, in order to promote healthy physical, psychological, and mental well-being, such as having them flu vaccinated, involving them to bloodletting activity, enjoying Easter fun day in the property, engaging them to daily activities such as movie and karaoke nights, live cooking demos and stations, and various physical, spiritual activities, and doing grocery run for the in-house associates. Never was a dull moment for our in-house associates during the lockdown, since they were enrolled to various trainings to further enhance their skills. So flash before you on the screen are the trainings done in the 3-month period that they were put on lockdown. So we have trainings courtesy of our housekeeping, front office, loss prevention, my own department, sales and marketing, culinary, finance, F&B, and engineering. And course trainings were also conducted by some associates who would want to gain knowledge on the operations of other departments. In housekeeping, 18 associates from our F&B and sales did retraining, cross training. And in my own department, 15 associates from F&B, culinary, housekeeping, and engineering undertook the training, and 3 associates from F&B in human resources and stewarding, respectively. So not only did we focus on our associates' welfare, but together with them, the hotel was able to fulfill its corporate social responsibility through the company's Serve 360 program. With our Raise to Raise program, the property was able to raise more than 23,000 pesos from associates' personal contributions to pay for 220 meal packs for the medical frontliners. Our hand-in-hand project produced 2,000 pieces of soups that were turned over to Barangay Old Airport for distribution to their constituents. And in April this year, 52 volunteers, associates donated blood in a bloodletting activity. So 15,750 cc blood was collected from the said activity. As to our new normal guidelines, the company is strictly implementing the following health and safety protocols. For our associates, they are required to observe the proper wearing of face masks at all times, practice physical distancing of at least 1 meter, practice of proper and frequent hand washing. So the hotel has installed alarm system to remind associates at the back of the house when it's time to wash their hands. Conduct of regular health screening, physical exam, and re-onboarding orientation. Face-to-face meetings and briefings is discouraged or kept to minimum number of attendees depending on room size if cannot be avoided. Virtual and online trainings are encouraged and facilitated the availability of flu for our associates. So number 2, heart of the house, public areas. So the following are the sanitation protocols. Associates cafeteria was rearranged to support physical distancing, while sanitizers and disinfecting agents are set up in strategic places. Footbaths at all entrances, including service lift landings. So floor markers installed to ensure physical distancing is observed. Directional signages installed. Office and room capacity information sheets posted to regulate maximum persons allowed per room, and sanitizing of high touch points and workstations every 2 hours. Part of the new normal practice of the courtyard is the commitment to clean standards set by the Marriott International. It covers a wide range of cleaning protocols encompassing the whole spectrum of hotel operations, such as cleaning and disinfecting of hard surfaces and shared equipment, provision of hand sanitizer dispensers, guidelines on personal hygiene, social distancing and greeting, and others. As to the wearing of issued free PPE, associates are reminded to follow below guidelines. All associates to wear face masks at all times. And then for those assigned to kitchen and as food servers, they are to wear face mask, chin guard, gloves, and hair cap. While room attendants are required to wear face mask, goggles, and suit only when sanitizing rooms, face shield, and gloves. For our engineering associates, face mask and gloves when doing repair and maintenance of rooms of confirmed COVID case guests. Loss prevention officers with face mask, face shield, gloves, and suit when interacting with LSI or returning overseas Filipino workers during their arrival or their scheduled swabbing. For our front office staff, face mask and concierge associates, face mask and gloves, and garbage disposal associates, face mask, goggles, face shield, gloves, suit, and hair cap. So in view of that total hotel approach, FNB is to implement the following guidelines that will also be the new normal practice of the hotel. On entry to the hotel lobby, guests shall be greeted with temperature check and a request from our loss prevention officer to accomplish the health declaration and contact tracing forms placed on the table just outside the lobby entrance. Positioned also on the table is the hand sanitizer and a reminder to observe health protocol. Signage to remind guests to practice social distancing and dispenser for hand sanitizer are also situated at reception area of the restaurant. At the dining area, chairs are arranged in such a way to encourage practice of social distancing among diners. That includes, of course, the table, the placement of the tables. Acrylic partitions are installed on tables. In compliance to government regulations, menu cards are no longer used in getting order from patrons. Instead, the hotel uses our iris system, wherein QR code is used for contactless menu ordering. It works both on iOS and Android mobile phone applications. As much as possible, patrons are encouraged to use online method of payment to minimize cash handling. Restaurant pay counters are likewise installed with acrylic guard for added protection. Okay. So in transition to normal buffet, the hotel instituted measures to ensure the safety of our patrons. So food placed on the buffet counter are just for display. Guests will have to choose their orders on iris, which will be communicated to the chef who will prepare the food accordingly. The newly cooked food shall be served by the server to the table for guests to enjoy. All the display on the buffet counter are covered by anti-sneeze acrylic guard to prevent food contamination. And to ensure strict implementation of Marriott commitment to clean, the hotel, specifically the F&B department, shall perform and comply with the following requirements. Get monthly certification that the hotel has fully complied with the commitment to clean standards. Accomplish the daily cleaning, disinfection, and hygiene checklist. Engineering department to perform monthly kitchen walkthrough to ensure all equipment are working properly and all safety guards are in place. And F&B to issue its own local LSOP for the new normal operations. Okay, let me end my presentation with these words from our Executive Chairman, Mr. J.W. Marriott, that serve as our guiding principle in running the business. That is safety first for first-class service. So we wish you all fruitful and safe day ahead. Thank you and God bless us all.
All right, thank you very much, Mr. Fernandez, for sharing your company's best practices on OSH. Indeed, sir, we are grateful to you and your establishment for making OSH not a mere compliance, but an exciting and rewarding way of life. Sir, please stay for a short while for some questions and clarifications later on from our audience po.
Okay, Janelle, thank you.
Sir Janelle. Sir Melvin po, sir. Wait lang po guys. Wait lang po mga kaibigan. Lumalabas po ba yung screen now? Okay. Okay, mag-round 2 po muna tayo. Ng ating 4 pick 1 word na activity po ulit mga kaibigan. Sa mga kakapasok lang po mismo sa ating webinar po or sa ating mismong KamOSHtahan activity, dito po sa ating game po, ito po yung ating mechanics po kung saan para po maging isang contestant po, meron pong itanong po sa inyo. At sagutin po natin po yung tanong po via the chat box po dito sa ating Zoom account or sa ating Zoom application. Kapag ikaw po yung tamang sumagot po, yung pinakamabilis sa pag-type, at tama po yung sagot, ikaw po yung maging contestant sa ating laro. Kapag tama po yung sagot mo po sa ating 4 pick 1 word, bibigyan ka po namin ng prize! At yung prize po natin ay isang OSH standards na hard copy courtesy of the Occupational Safety and Health Center na dito po kunin sa Iloilo City. So game na po ba? Game ka na ba? Tingnan na lang po natin po sa mga iba po na hindi po taga Iloilo City. No, marami na nandiyan naman po mga focal po natin rin in other regions. Start po tayo. Okay, yung tanong. Mga kaibigan, anong date? Kasi po we are now in our 33rd anniversary po ng Occupational Safety and Health Center. So anong year na-establish yung Occupational Safety and Health Center? Complete po dapat with month, date, and year. Once again, anong date po na-create or na-establish yung Occupational Safety and Health Center? Kompleto po dapat sa month, day, and year. Parang wala pa pong tamang sagot. Once again, what year or what date na-establish po yung Occupational Safety and Health Center who is already celebrating its 33rd anniversary? Kung kanina po, kung early po yung pagpasok mo po sa video mismo, makikita po kung ano po yung date na establish ng Occupational Safety and Health Center. Dapat po may month, day, and year. Para meron na po tamang sagot. Yung tamang sagot po kasi is November 4, 1987. At yung nanalo po ng tamang sagot is, tama po ba ito si Sir OSHC REU8 John Aranda? So REU8, Sir, tama po yung sagot po November 4, 1987 po yung pag-establish ng Occupational Safety and Health Center. Oh, wait lang po sir, meron po nagre-reklamo sir. Meron daw po nauna pa sa iyo. Tingnan po natin.
Si Sir, I think si Sir Jillian.
Dito kasi sa laro natin, dapat pabilisan po talaga sa pag-type po at dapat tama po yung sagot po natin. So yung pinakamabilis pa pala, si Sir Jillian, sir po ba ito? Gillian Gale. Ma'am po, Miss Gillian Gale Gilaver. Tama po ba ma'am sa pagsabi po?
Yes, sir.
O ma'am Gillian, kayo po yung maging contestant po natin. Sir John, baka po sa next po, after this po, baka kayo na po yung maging next contestant. Tingnan po natin. Pero ngayon po, Ma'am Gillian po, kayo po yung first contestant po natin para sa round 2 ng ating activity. Ready na po ba, ma'am?
Yes, sir.
Alright. Ma'am, pili po tayo ng category. Ano po?
Health.
Health po tayo. Ma'am, sa health po, bawal na po piliin yung number 3.
Sige pa.
Ma'am, from 1, 2, and 4, ano po?
4 po.
So 4 po. Ma'am, kapag tama po yung sagot mo po dito sa ating challenge po, you will receive 1 OSH standards from the Occupational Safety and Health Center, Region 6. Taga saan po tayo, ma'am?
Pavia, Iloilo po.
Okay. Okay naman po. From Iloilo Province.
Yes po.
So number 4, ma'am, no? Yung ating
Yes,
pong pinili. Sige po. Ito, ma'am, yung challenge po natin. Number 4. Ma'am, ano po hinahanap po natin dito?
HIV po.
Ano po, ma'am?
HIV po yung answer.
Final na po?
Yes po.
Kasi po yung, tingnan natin kasi yung tamang sagot po ay, tama po, ma'am, it's HIV. Congratulations, ma'am. Mamaya po, please stay po. Wag pa po muna mag-leave po tayo mamaya after ng post-evaluation kasi we will be getting your details para kung paano mo po makuha yung ating OSH standards po dito sa office.
Yes po. Okay, copy po, sir.
Congratulations po, Ma'am Gillian.
Thank you. Thank you, sir.
Okay, proceed po tayo sa second contestant po natin. Sir Jan, baka ito na po yung time natin. Okay. Okay, next question po. Dapat pabilisan po ito sa pag-type po, mga kaibigan, at dapat po correct spelling yung ating pag-type po. Now the question is, who is the current Executive Director of the Occupational Safety and Health Center? Ang bilis! Pero wrong spelling. Meron na po tayong tamang sagot. Yung tamang sagot po ay, okay naman po kahit walang engineer. Back po tayo, back. Ito po, ma'am, tama po ba si Sir RJ? O si Sir RJ po yung ating contestant.
Hi, good afternoon.
Hi po, Sir RJ. Sir, taga saan po tayo? Iloilo rin po ba?
Hindi po, I am from Rizal, Cainta Rizal.
Ikaw po yung aming first contestant rin po from outside Iloilo. Sige, sir, pili po tayo ng category.
So, I will go for health.
Health rin po. Sir, sa health po, bawal na po yung number 3 and number 4.
Okay. Okay, number 1.
Sir.
Number 1 po.
Number 1. Sir, your challenge for number 1 is... Sir, ano po ba ito?
Ergonomics.
Ergonomics. Final answer po ba, sir?
Yeah, final answer.
Sige po, tingnan po natin kasi yung tamang sagot po ay... Tama po, sir, ergonomics! So, congratulations, you won yourself 1 OSH standards from the Occupational Safety and Health Center, Region 6. Tingnan na lang po natin kung paano natin makuha po, sir. Pero we will coordinate with the focal, sir. So, can you please, later on po, please do not leave yet sa meeting natin kasi kunin namin po yung information mo po.
Thank you.
Once again, sir, thank you very much po. Congratulations. So, that's the second round of our activity po. Mamaya po, may last pa tayo na round po for our 4-pick 1 word na game. So po mga kaibigan, we're actually now down to our last but not definitely the least topic of this webinar. Now, yung ating pong webinar session po, topic number 3, once again, 30 minutes topic on the labor management and cooperation for a safe and healthy workplace. Now, our resource person is the Supervising Labor Employment Officer of the Regional Conciliation and Mediation Board number 6 for Western Visayas. Ladies and gentlemen, please help me welcome the beautiful Miss Melinda M. Lee.
Sir Melvin.
Ma'am Lee, good morning.
Yes, good morning, Sir Melvin.
Yes po, ma'am.
Marinig
Yes
ba?
po, ma'am.
Okay. Good morning to everyone. Luzon, Visayas, and Mindanao. Please, from NCMB, nagpapasalamat po ako kay Sir Melvin Milicoton for inviting us, NCMB, National Conciliation and Mediation Board, to share our programs from labor management, cooperation, and the grievance machinery. Thank you, Sir Melvin, and good morning again to everyone and to my colleagues there. Good morning. So may I share my my presentation?
Yes, ma'am.
Yes. First, after ng mga OSH safety, mga ganyan na discuss this morning, so we'll now go to relationship. So the first topic this morning na share ko sa inyo about NCMB and programs namin, being one of the attached agency, the Department of Labor and Employment, is the Labor Management Cooperation, our Workplace Cooperation and Partnership Program. So what is this? What is Labor Management Cooperation? The Labor Management Cooperation is a state of relationship where labor and management work hand in hand to accomplish certain goals using mutually accepted means. When we say acceptable means, syempre sa ating mga opisina, lahat naman tayo, mga ka-office, mga katrabaho natin, maliban sa mga sa relationship natin sa family, sa opisina natin, di ba we have a relationship between sa ating mga office mate, mga co-workers, sa ating clients even though. So, ang management, ang labor, and the employees are work hand in hand to accomplish certain goals. Says, nag-ano tayo sa ating mga workplace, di ba? Nagmi-meeting tayo. Why? Bakit tayo kailangan mag-work hand in hand? Because the labor and management, or the labor and the employees, the cooperation between them, it is the outcome of the continuing process of enhancing mutual trust and respect through information sharing, discussion, consultation, and negotiations. This is also the skills of workers' participation in decision-making processes. But when we say schemes of workers' participation, syempre, kung mag-meeting tayo, syempre, may information sharing from the management and also to the employees from the employees. Also, we discuss, we consult each other, we negotiate each other. Kung may LMC tayo, kasi sa office namin, sa agency namin, the outcome of this presentation is we build the labor management structure. When we say labor management structure, we have the representative from the management and also from the employees. Kasi nag-meeting na tayo, andyan na yan. Pero lalo na kung hindi lahat ng time na lahat ng employees na meeting, syempre may representatives lang siya from the management and also from the employees. That's we call the labor management structure, the LMC structure. Then, kung nag-meeting tayo, ba nag-communicate tayo, how How this all relate to enhancing workplace relationship? The communication, kung nag-meeting tayo, di ba, nag-communicate with each other. Says, natin, communication is the heart and soul of any relationship. Diba? Heart and soul of every relationship. Kasi kung walang communication, maraming nag-aaway, miscommunication, misunderstanding, diba? Kung hindi nagko-communicate. The LMC, we have the labor and the management to operate. This serves us as a channel of communication between management and employees. When we say communication, yes, because nag-meeting tayo, di ba may inputs from the employees, may inputs from the management, lalo na ngayon sa pandemic. Kung wala tayong communication, hindi tayo magkaintindihan. Kung may, kung may mga issues ang employees, di ba dapat i-discuss ang management. Likewise with the management, the standing of the company, the situation of the company, whatever kung anong man ang sitwasyon nila sa isa-isa, between sa employees, the relationship, di ba kung may meeting sila, the labor and the employees, di ba they communicate with each other, they have the channel of communication. And kung maganda ang relasyon ng management and employees, this promotes cooperation between partners. Tingnan mo naman, walang imposible kung nagtutulungan. We can build it. Next, the LMC harmonizes and strengthens labor and management relationship. Tingnan nyo naman sa mga pictures, di ba? May pagkaisa. Di ba sabi natin, kaya natin ito pagsama-sama. Maski anong man ang sitwasyon ngayon, pagsama-sama, yan, mas strengthen pa rin ang relationship natin. So LMC also contributes to the progress and stability of the company. Yes, siyempre, pag nag-contribute, pag may openness of communication between the management and the employees, siyempre, the progress and stability of the company. Silang dalawa ang yan, ang partners. Kasi kung wala ang management or wala ang employees, paano makastala ang company? Hindi sila kaya. Dapat, they are social partners. And why there's a need for the management and workers to cooperate? Then, because workers and management are social partners. Diba? Social partners. Hindi naman makatayo ang isa pag walang isa. Diba? Are social partners sharing a common interest in the success and growth of the enterprise. Lalo na ngayon because sharing of common interest tayo. Lalo na ngayon at sa everyday. And kung mag-meeting tayo, yung may LMC structure tayo, may representative ng management and employees, what are usually covered by LMC? Ano ba pwede natin i-discuss kung mag-meeting tayo? Personal policies, di ba? Kung may meeting, o may mga amendments sa policies, o magpatawag ng LMC meeting, may structure na, may representatives from the employees and the management. Di ba? Pwede kang mag-announce ng personal policies, may mga bago, may mga announcement, production plans, business expansion programs, productivity gain sharing programs, job security, di ba? Pag-usapan natin kung may meeting. Improvement of quality of work life, introduction of technology and new technology and machinery, retrenchment programs, business mergers or closure, workers' welfare and livelihood programs, sports, recreation, and social activities, productivity improvement programs, occupational health and safety program. Diba? Kanina nag-discuss tayo from the start of this webinar, occupational safety, diba? May mga compliance, may mga sharing of best practices. Diba? Occupational safety, that's part of your LMC. Family welfare programs, the grievance and ethics, and the bipartite compliance. Diba may bipartite compliance? Diba? Dapat ang management and employees, they have, sabi ko nga, may common interest. So di ba dapat may mga i-comply naman ng both parties? Di ba kung may mga agenda sa meeting, nag-meeting. Pagkatapos ng meeting, di ba dapat mag-meeting, dapat may minutes of meeting. Para naman may balikan tayo. Kasi kung walang minutes of meeting, syempre, paano mo naman ma-recall doon kung na-accomplish ba ang pinag-usapan during the meeting? Kasi kung puro lang tayong meeting, hindi naman documented, wala natin balikan. Parang wala naman, sabi nila. O parang di ba yung sinabi natin last meeting, parang ganito, ganyan, magganito tayo. Wala naman kasi wala mga minutes of meeting. But if naka-record ang mga minutes natin, may minutes yan, naka-record ang meeting natin, whatever kung anong pinag-usapan natin, then for the next meeting, may balikan tayo. That's from the LMC meeting, the labor and the employees or the management, the labor and the management meeting. Next, itong sinasabi ko kanina sa inyo na structure, this is ano lang siya. Kita mo may LMC, the Labor Management Corporation, Council Steering Committee, may secretary kayo dyan, may Productivity Committee, may Family Welfare Committee, syempre may mga members dyan, Bipartite Compliance Committee, the Safety and Health Committee. Kasi yung LMC siya yung pinaka-lead. Tapos siyang mga mga committees niya, isa na dyan ang Health and Safety Committee and the Grievance Committee. Yan ang structure na sinasabi ko ng committee sa mga companies natin. So, pag-put up ng committee, syempre from the may mga representatives din yan. Kayo din ang mag-select niyan from the management and the employees. That's the LMC committee, tawag natin. The LMC structure. So, kasi summing up is ano ko lang yan, ang mga basic orientation lang namin sa LMC. It's 11, it's 30 minutes, and kasi ang LMC sa presentation namin, medyo na siya medyo marami pa siya sana i-take up. Kaya lang, ang time natin, binigyan lang tayo ng participation for 30 minutes. And kung may tanong naman kayo mamaya, pwede naman natin sagutin. At saka pwede rin kami mag-lecture sa inyo via platform ng Zoom, or kung na siya, mag-plant level orientation din kami sa inyo. This is part of our programs of NCNB. And summing up, for the LMC, the basic concept of LMC is for workers and management to work together, to be productive, produce quality outputs, to have a common understanding and maintain stable relations, to grow and develop and to achieve common goals. Diba? Concept sa LMC, ang magandang relasyon na isa, workers and management. Diba? To be productive, paano na lang kung hindi kayo nagkakaintindihan? Even sa workplace. Diba? Sa workplace, hindi kayo nagkakaintindihan. Paano ka maging productive? Paano ka makaproduce ng quality outputs? Hindi ba iba-iba ang common understanding nyo? Paano tayo maka-build ng stable relations? Diba? This one is pandemic. This situation, hindi natin ito inasahan, diba? Dumating siya. So, kung hindi na tayo stable ang relationship, paano na kaya ang mga companies natin? Paano na kaya more ang relationship? Paano na kaya masustain natin ang ating trabaho? Even sa ating mga trabaho, even we work on skeletal forces, siyempre yan, pinag-usapan din yan. Kasi mas maganda talaga kung maganda ang relasyon ng isa-isa. Kasi mas open tayo. Mas mas maintindihan natin ang participation natin. Diba? Yan ang LMC.
Mga bata.
The keystone for successful business is cooperation.
Si Dana ka game niya.
Progress. Diba? Kung mag-aaway, syempre, paano mo progress? From James Caspen. Okay, that's from LMC. Another one, no employer today is independent of those about him. He cannot succeed alone, no matter how great his ability or capital. Business today is more than ever a question of cooperation. Yes, yan. Sir Orison Sweet Marley. I hope nakaintindihan natin ang ating part as employer as also from the employees. Thank you from LMC. Now, punta naman tayo ngayon sa grievance ba sila? This is our another program, the grievance machinery and the voluntary arbitration. This is the pathways to conflict resolution. So, what is conflict? Conflict is a natural part of life. It is a undeniable aspect of any relationship, group, or organization. Iba conflict, wherever it is, wherever we are, even sa bahay natin, sa trabaho, hindi naman tayo wala naman tayo relasyon, ka-office mate tayo, syempre mga conflict, hindi natin maiiwasan yan. Diba, conflict is a natural part of life. Then, being so, tingnan natin sa bahay, being so, it is imperative that we know how to deal with conflict, to deal with others easily, smoothly, and effectively. Yes, tingnan natin, even ba sa bahay, even sa remote na nga nag-aaway, ano pa kaya sa opisina, yun ang iba-iba ang values natin, iba-iba ang education natin, iba-iba, di ba? Ang pag-ano natin, hindi naman tayo isang bahay, even pang isang bahay tayo, nag-aaway pa rin, di ba? Mag-asawa, nag-aaway rin, ano pa kaya sa workplace? O tingnan natin, that's it. That's conflict. So the state has set mechanism in place to address conflicts, problems, and dispute in the workplace. So, nag-create ng mechanism sa workplace to address these conflicts. What? Conflicts and disputes in the workplace are usually in the form of grievances. Grievances. What is a grievance? Sabi natin, grievances. What is a grievance? Grievance is any difference or dispute between an employee and the employer with respect to interpretation, application, or compliance with any terms and conditions of the company rules and regulations. Diba, each company has an company rules and regulations. Sa pag-apply natin ng trabaho, di ba, meron na tayong orientation. Di ba, pina-understand natin, this is the company personnel company. This is the rules and regulations. But then, kung nagkatatrabaho na tayo, di ba, kung minsan nga, di ba, ini-issuehan tayo ng memo kasi nagba-violate tayo. Di ba? Yan ang ibig sabihin yan. Yan nagagaling ang grievance eh. Diba? Hindi tayo nagkaintindihan. May na-violate na company rules and regulation. That's grievance. Diyan nagmumula pala yung grievance. Ang grievance, nag-initiate yung grievance, sabi ko, violation of company personal policies or rules and regulation. Number one, violates, lalo na, employee violates company policy. Ano ginagawa natin pag nag-violate? Mga HR dyan, siyempre mga HR. Nagkabayin na mga HR, mga owners, yan, supervisors, diba? Nag-ano tayo? Issue tayo ng notice to explain. Katapos ng notice to explain, diba? Hinihiring natin. Diba? Ano ba? Diba? 5 days tayo, alam ba natin, 5 days tayo, naghihintay. Within 5 days, mag-explain tayo. Mag-explain ang response sa notice to explain natin. Tapos diba, i-hearing a decision. Management disciplines hearing employees through disciplinary action. Diba, may mga tayo. May mga company personnel.
Ayan, jargon yan.
That's, three notice. The notice to explain and the decision. Ito, ang grievance kasi, lalabas na siya ang grievance. Employee questions disciplinary action and files a grievance. File na siya. Mag-file na siya ng grievance. Kasi hindi siya kasi, feeling niya aggrieved siya. Minuhan ka na nga. Nag-submit ka na ng explanation mo within 5 days o within 5 days. Tapos, hindi ka parang feeling mo, bakit ganito ang ano sa akin, ang sanction sa akin? Bakit 15 days wala akong sweldo? Bakit 1 month akong diba? 1 month na wala akong suspension. Another grievance initiation, sabi ko interpretation of company, kanina violation. Ngayon naman, interpretation of company personal policies and rules and regulations. Even though sabi ko may orientation, kung minsan iba-iba pa rin ang interpretation. Iba naman ang interpretation, iba naman ang nag-violate. Kasi interpretation mo ng company kung minsan, kaya naka-violate ka ng policy. Yan, isa pang initiation sa grievance. Pwede naman. Ang grievance, the aggrieved party. Pag ikaw aggrieved party, kasi feeling mo, bakit ganito? Bakit 7 days? Bakit 15 days? Kasi masakit din masuspend, ano? Kasi no pay. Diba? So, this is the simplest way, the general ways and steps of grievance. Ang aggrieved party, pupunta siya sa employee representative. Pupunta siya doon. Ano niya din ang party niya? Ang feeling niya. Ano ko lang, pinado ko lang siya, in-emphasize ko lang, na hindi pa siya sa grievance, pupunta sa grievance machinery later. Kasi dapat may sanction na siya, the aggrieved party. O pupunta sila ng employees representative because pareho ng LMC, may grievance structure din tayo. May grievance sa may management representative and also from the employees representative. Kaya ito na, aggrieved party, pupunta siya sa employees representative. Then, the aggrieved, nila, mag-usap sila. Okay, sabihin mo kaya, validate muna ng employee representative, sabihin niya naman, tama naman kaya ito ang sanction mo, tama naman ito, parang may bagbasihan din. Pero pag sabi niya hindi nila ma-settle, ang aggrieved party, pupunta sila sa HRD. Doon sila mag-arrange ulit. I-validate naman ulit, evaluate naman ulit na sa HRD department. Kasi kung minsan baka may na-mislook lang sa pag-hearing nila, sa pagsagot niya, or may mga kulang sa mga details. So, kung hindi pa rin sila ma-settle, kung magsabi naman ng HRD na, ay tama naman ito ang sanction sa iyo, yung memo sa iyo na sinagot mo, ito na ang decision, parang may pagbasihan talaga sa HRD na yan. So, pag hindi pagin talaga sa aggrieved party sa kontento, pupunta siya sa grievance committee. Sa grievance committee yan, ang nasasabi ko na, the representative from the company and the representative and the management, likewise with the employees, sila na yun, pag-usapan nila na yun, kung whatever, ano ang dinala nila sa grievance committee, from most especially sa sanction na siya, from the sanction, sana receive na ng aggrieved party. Gusto niya grievance kasi aggrieved siya, feeling niya aggrieved siya talaga. So, sa grievance committee, it's either i-uphold nila decision. Pwede, kung sabi nila, kasi pwede naman sa grievance committee, parang appeal, parang appeal na siya. Pwede mo siyang i-appeal. Likewise, kung ang na-violate mo sa company is example, ang imo sanction is termination. Feeling mo aggrieved ka, you don't deserve to be na ma-terminate agad sa ganun mo lang na violate. The grievance committee. Sabi ng grievance, oo, tama. Baka hindi naman ito sapat para i-terminate siya. I-lower back. Parang i-mitigate siya ng grievance committee. Ay, ano na lang natin ito? 2 months na lang or suspension. Pwede i-ano na lang siya. I-mitigate na lang siya. Diyan sa grievance committee. The affiliate committee na lang siya. That's the appeal. Pwede mo nang i-appeal dyan. Yun ang in-establish namin sa programs namin, the grievance machinery sa mga companies. Dapat naman talaga may grievance. Kasi syempre, kung minsan kasi, dapat sa plant level na siya muna i-arrange ng mga employees and the employer, whatever ang mga hindi nila pagkaunawaan. Like for example, hindi na sila abot sa grievance machine, sa grievance committee, sa LMC pa lang, pag-usapan na nila whatever it is. Kasi kung mahanda ang relasyon nyo, hindi naman kailangan umabot pa kayo sa grievance. Kaya syempre, the labor and the employees are social partners. Then, kung hindi pa na-resolve ng grievance, kung hindi na-hold na grievance ang termination or 1 month suspension, feeling ng employee, the aggrieved employees, hindi ka talaga ako dito deserve. So that's the time, the grievance committee, pupunta na siya sa, dito kasi voluntary arbitration siya, no? The grievances are taken up in the grievance machinery. Tingnan nila, the grievance machinery. The grievance machinery, sabi ko nga kanina, a mechanism established for the adjustment or resolution of grievances. Doon na siya sa steps kanina, doon na siya sa grievance machinery, doon na siya gina-adjust ang resolution of grievances. At kanina, yung pinakikita ko sa inyong steps, this is a series of formal steps that parties to collective bargaining agreement if the company is organized. Siyempre may CBA yan. Andyan na yan kasi sa CBA nila. the grievance machinery, ano nila, andyan na talaga yan sa CBA nila, sa organized, mas organized. Pero sa mga employees and organized, syempre, our workers and managers agreed to take for the adjustment of grievances, including voluntary arbitration as the terminal step. Sa CBA kasi nandiyan na yan yung grievance machinery nila. That's mandatory provision of the CBA. Pero kung sa mga unorganized companies, syempre, ina-establish natin din ang grievance para may machinery din sila sa plant level to adjust naman sa ilan resolution and grievances. The reason for establishing grievance machinery. Bakit ba mag-establish ng grievance machinery? To give employees an opportunity to voice their concerns again. To provide employees with the opportunity to appeal a decision and resolve the problem. Siyempre, hindi ba sa mga employees dapat naman sa employer, siyempre, always may due process. Diba? Due process. Siyempre, sa due process, andyan na yan kasi may notice ka na nga, may pre-notice na tayo. Pero siyempre, hindi naman natin makontrol and the feeling the employees, even sabi niya, agrabyadong feeling niya pa rin. To prevent minor disagreements from developing into a full-blown dispute. Kasi kung mapag-usapan pa lang yan sa sa companies, pwede naman yan, bakit dalhin pa sa labor? Siyempre kami naman sa Department of Labor, trabaho naman namin yan. Pero kami din, nagagawa din, the state also, kami din, naglagay din sa company, help the company to provide LMC and grievance in sa plant to prevent minor agreements. Para doon na lang nila ang opportunity nila sa isa-isa para mag-usap. Kasi, syempre, mabuti pa rin na at the end of the day, ma-resolve nila yung mga whatever nila miscommunication, misunderstanding sa company level nila. To provide systematic to provide for peaceful resolution of disputes. Siyempre, maganda pa rin ang peaceful resolution to provide a systematic way to resolve problems through fact-finding, to identify causes of problems. Diba ang pinagawa natin? Di ba na-identify muna ang problems? Keep lines of communications between the parties during the life of the contract. So, sabi ko ina, and the end result of the grievance machinery, pag may formal step siya, from the supervisor, from the employee's representative, to the supervisors, to the HRD, to the grievance committee, pag hindi pa rin siya na-resolve, and feeling niya agrabyado pa rin, so the end step of the grievance machinery is voluntary arbitration, also the programs of NCB. And what is this? The voluntary arbitration is the mode of settling labor management disputes by which the parties select a competent, trained, and impartial person who shall decide in the merits of the case and whose decision is final, executory, and binding. And the voluntary arbitration is the terminal step in the parties' grievance machinery. Kasi itong voluntary arbitration, non-litigious proceeding, lost, costly, and speedy. Mas madali siya. The voluntary arbitration kasi, hindi ito the original and exclusive jurisdiction of voluntary arbitration, all unresolved grievances arising from the interpretation or implementation of the collective bargaining agreement. Siyempre, dun sa mga organized companies yan ha, kasi inilagay ko yan dito kasi this is the original and exclusive jurisdiction. And all unresolved grievances arising from implementation or enforcement of company personal policies. When we say unresolved grievances, sabi ko kanina, pag sa grievance, feeling ng aggrieved party, hindi pa rin sila makaintindihan, hindi pa rin na-resolve ang pagkagrabyado niya, then may voluntary arbitration pa. This is another program of the NCMB, and the voluntary arbitration, the voluntary arbitrator from the voluntary arbitration program will resolve their grievances. Likewise, sa interpretation and enforcement of company personal policy. Then sabihin nila, so ipa-VE na lang natin ito kasi the voluntary arbitration, siya na ang mag-select and the parties will select The voluntary arbitrator, this is the voluntary arbitrator. This is ano siya, accredited by NCMB. This is the usually they are lawyers, the HR practitioners na ano siya na NCMB, na credit. So may rosters list kami yan na mga list of voluntary arbitrators. Doon kayo, punta kayo sa amin, hingi kayo ng tulong, magpa-VA kayo. Because for the issues na hindi na resolve sa plant, from the grievance machinery, for the, ano na siya, from the unresolved arising from implementation or enforcement of company to personnel policy. So, pupunta kayo ng NCMB, sabihin nyo sa amin, magpa-VA kami, mag-request kami for assistance for board arbitration, so the NCMB will assist you. Oh. So, at saka VA, sabi ko kanina, sa VA subsidy, kung may VA subsidy, wala kayong babayaran because may VA subsidy yan. Parties to a VA case may avail of the subsidy. Kung isang issue nyo sa interpretation, isang issue lang, hindi kayo magkaintindihan, pina-VA nyo, pwede kayong ma-assist ang parties. May VA yan. Kami na, sa party sa NCMB, may subsidy yan. We call it VA subsidy of parties. Both parties can avail that. This VA subsidy, kung single issue ang pinapa sa arbitrator, that's a single issue, pinapa-resolve nyo sa arbitrator, that's 25,000. Kung two or more unrelated issue, that's 40,000. That the parties may avail, both parties may avail of this subsidy. This is payable to arbitrator. Sa arbitrator na. Kayo ang mag-select ng arbitrator na para pag-interpret and pag-resolve sang unresolved issues from the grievance of the plant level. So, advantages of voluntary arbitration, the speedy resolution of unresolved issues in the grievance machinery. Technical rules of court are not strictly applied. Parang hindi siya technical. The voluntary arbitrators and members of the panel of voluntary arbitrators are selected by the parties themselves. Kayo ang mag-select ng voluntary arbitrators na. Sasabihin siya. Failures of the parties to select common arbitrator or panel of arbitrators, kasi pwede din panel. The NCMB shall designate voluntary arbitrators pursuant to the selection procedure of CBA. Sa CBA naman yan. So, sa voluntary arbitration, the grievance machinery, the goal of resolving conflict is not really to determine who is right and who is wrong. It is restoring, healing, and relationship. Kung pwede palang ma-avoid ang mga conflict, lalo na sa plant, so, di ba, hindi naman talaga masyado, pero lagi na who is right and who is wrong. It is restoring and healing relationship. So, from LMC, from NCMB, National Conciliation and Mediation Board, our program, LMC, the Labor Management Corporation, to the grievance machinery and the voluntary arbitration. Thank you so much.
All right. Ay, sana all merong restoring and healing relationships po, ma'am. Ma'am Lee, thank you very much for providing us the vital information about the LMC, leading to a safe, harmonious, and productive workplace. Ma'am, please stay for a short while for some questions and clarifications from our audience.
Sir Melvin, again, from NCMB, from our director, Director Gina Kumilapoy, all the staff of NCMB, thank you so much for inviting us.
You're always welcome po, ma'am, as part of the Dole RCC.
Salamat po.
Thank you po. So, all right, mga kaibigan, we proceed to one of the awaited parts of the session, the Q&A segment. May call on Ms. Nellin Joy Valenzuela, Regional Training and Technical Service Staff, to facilitate this segment. Ma'am, you have the floor.
Good morning, everyone. These are the questions gathered through our webinar chat box and through Facebook Live. Okay, so these first questions are for OSHC Engineer Helen Diaz. Engineer?
Yes, go ahead, Ms. Nelly.
Okay, so ito po yung first question from RJ Clement Jimenez. Number 1, With regards po sa registration, does this include SMEs, massage parlor, salon, water refilling station, and others?
Yes, as mentioned earlier, all establishments are required to register with DOLE pursuant to Rule 1020. So lahat po ng establishmento, as long as may workers kayo, you are mandated to register your establishment with DOLE.
Okay, thank you po. Second question, in addition po sa HIRAC, since this is a determinant of risk category, in case controlled po ang risk or hazards in the workplace and ang risk category po ba ay bababa rin? I mean, magiging medium or low risk na po siya?
Yes. If you are familiar with the conduct of hazard identification, risk assessment, and control, if you have control measures in place, so the risk category will lower. 'Di ba? Mas bababa yung risk classification natin because you have control measures in place. So, but of course, there are some cases that automatically they are they are classified as high risk. So it was enumerated on Department Order 198 series of 2018 kung ano-ano yung mga establishment that are automatically identified as high risk establishment. Okay? So, yung mga establishment like construction industry, even if you have your control measures in place, you are still considered as high-risk establishment. So, even yung mga, yung mga LPG refilling stations, storage, and distribution, they are considered as high-risk. So, those that have been mentioned on the Department Order 198, kung ano yung classification nila doon, hindi na po yun magbabago.
Okay po. Thank you po. The next question is, in reference to the conduct of confined space training, are we safety officers authorized to conduct actual confined space or just theoretical?
Okay, for definitely when you do training, initially you have to conduct it in a room setup, okay, in a room setting. Okay, then if you have the right equipments, because the risk is if you are going to conduct the training actually, the risk is you might be automatically be exposed to hazardous working environment. Especially if you do not have the equipments to monitor the concentration of the hazards that might be present in your confined spaces. So definitely the training on confined space entry is or should be done in a room first. Okay, so much better po yung room setting muna bago tayo mag-actual kasi pag actual po, you are exposing already your workers to the hazards and they are not equipped yet. Okay, they do not know yet what to do in case there are hazards that are present, especially for highly toxic substances, and they will be automatically exposed to that. So room setting is highly recommended po for confined space safety or entry permitting system.
Okay, thank you po. The next question, are there STOs or companies who are authorized by OSHC to conduct confined space and rescue procedures training?
Well, we have available consultants. Okay, consultants. There are lots of consultants available who are accredited by DOLE, and they have those services. So you just refer to our website for the list of the training organizations and consultants or consultancy. You can check with them on their capabilities. Okay, so there are available consultants who can give those particular training for establishments who need those trainings.
Okay po, thank you. The next question, with regards to heavy equipment, is it necessary to conduct load testing and certification for forklifts or counterbalance categorized as heavy equipment?
Yes, of course. It's part of the testing for your technical safety inspection of your heavy equipments. Part of the testing is you have to determine what is the safe load limit for your heavy equipments. So that will definitely form part of your technical safety inspection. But of course, this particular testing should be conducted by a competent individual. Okay, so meron po tayong mga certified institutions and individuals who are really or indeed certified to do the testing. So kasama din po yung load testing dyan sa mga technical safety inspection to determine the safe weight load limit of every lifting equipments.
Okay po. Last na po. With regards to the conduct of WEM sa BPO, is it necessary na WEM or indoor air quality is enough? How about sa construction, kailangan pa rin po ba or ambient air is okay na rin po?
You know, indoor air quality is actually part of the work environment measurement because indoor air quality, before you'll be able to find what is the quality of your air inside your workplace, you have to do the work environment measurement. Okay, so the indoor air quality forms part of your work environment measurement because you have to check what are the contaminants that might be present in your air. Are there any hazardous vapor or any hazardous gases or any volatile organic compounds that might be present in your air? And that is also part of your indoor air quality. So how are you going to know the quality of your air if you are not going to conduct the work environment measurement? So definitely, indoor air quality should pass through the work environment measurement. Parte po siya ng work environment measurement natin.
Ma'am, may pahabol
Hello
po
po.
dalawa.
Okay, go ahead.
Okay, pahabol po. How about po sa mga malls at tenants? High risk po ba sila?
Well, it varies. Okay, so sa mga malls kasi, there are some that might be high risk, especially if they have storage of chemicals, large concentration of chemicals. So, but one mall differ from each other. Okay, so it varies. They have to conduct the hazard identification, risk and assessment. Okay, but of course, those tenants, example, display areas. Okay, so they are just considered as low risk establishment for that matter. So only those who have hazardous chemicals, hazardous machineries and equipments. So for those who have those equipments in their workplaces, so they might be considered as high risk. But generally, tenants in the mall area, they are considered as low to medium risk only.
Okay po. May isa pa po. Who are those third-party testing orgs or who are authorized to conduct inspection of equipment?
Okay, of course, when there is the third party that is being accredited by DOLE. Okay, so mayroon po tayong mga third party na nagkakandak to certify that your equipments are functioning or they are okay to use. And of course, when they conduct that particular testing or inspection, they have to inform the DOLE. They have to inform the regional office or the office that have jurisdiction over them because we have our technical safety inspectors that should go together with those third party that was going to conduct the testing of those heavy equipments or equipments. Okay.
Okay po. Thank you po. May questions po ba for Engineer Maria? Yes? Wala na po. Okay. Thank you very much, Engineer Maria Diaz. Now, we proceed to questions for RCMB for Ma'am Melinda Lee. Ma'am Melinda?
Yes, ma'am.
Okay, ito po first question from Patrick James Mayol. May free training o orientation po ba on LMC if mag-request kahit small company sa NCMB officer? Sa NCMB office?
Yes po. Lahat po ng trainings namin free po ang mga trainings. So sa plant level, we are very happy kung mag-request kayo ng training o especially sa mga lectures sa mga programs namin, even to the plant. Ngayon lang tayo nag-virtual kasi di pa tayo pwede, di ba? Pero pag talaga yung tinatrabaho naman kasi namin, pag plant to plant kami. Kung minsan nag-area-wide seminars, we invited mga companies, different companies. Pero kung gusto nyo sa plant, kayo lang, pwede rin. That's for free.
Okay po, thank you. The next question is, how frequent is LMC meeting done? Pwede po sabay sa OSH committee meeting?
Yes, of course. Pwede, pwede. Kasi sa structure ng LMC nyo, nandun kasi sa committee doon, sa LMC is OSH, di ba? Sabi ko nga kanina, so sa agenda, pwede man lang mag-LMC meeting tayo. At saka schedule ng LMC meeting, kayo din na mag-schedule niyan sa accessibility sa inyo, sa mga kaopisina nyo, sa opisina nyo, sa plant. Hindi ba kayo mag-request ka ng LMC meeting every month, once a month, every week? O, depende sa inyo yan. At tapos kung anong agenda, syempre, yun. Agenda yun, mag-LMC meeting tayo. Agenda natin ngayon, OSH. Pag-usapan na ng OSH. So mag-LMC meeting ngayon, OSH talaga pag-usapan nyo. May agenda kasi kung mag-LMC meeting, ano. At both parties agrees for it.
Okay. Salamat po. The next question. Ask lang po ma'am, paano po ma'am pag may death threat po na na-receive tapos ang company po ninyo ma'am ay hindi po nila ni-report sa police po?
Ako pa ba? Ako ba sasagot? Kasi hindi natin kasi control yan eh. Di ba kung may death threat ka dapat, ipag-blocker mo muna. Kunting knowledge about your question. May question mo kasi ako niya. Kaya kung may death threat ka, example sa mga question mo dyan, dapat diretso ka muna sa police. Paano muna? Pinaka-basic yan. Ma-record mo muna yan.
Okay, yan lang po. Opo. Maraming salamat po, Ma'am Melinda Lee. Okay, so far wala. Okay. So far wala pong questions for Mr. Raul Fernandez. Are there any questions or clarifications for Mr. Raul Fernandez? Wala pong question, sir. Klarong-klaro po yung presentation niyo. Okay, this ends the Q&A segment, but if you still have any questions or clarifications, you may submit them via our email address or leave a message in our Facebook page.
Alright, wala na po silang tanong, sir. Siguro for Sir Raul or for Courtyard by Marriott, punta na lang sila dun, sir, at mag-conduct po ng assessment. Mag-site visit na lang po sila mismo.
Sir Melvin, excuse.
Oh, ito pala. Yes, sir. Sir Dexter.
Yes, sir. Regarding lang kay Ma'am Melinda, I have a question, sir.
Ma'am Mel?
Ma'am, yes, ma'am. Dexter Mendoza, ma'am, safety officer from Monolith. My question, ma'am, is mayroon po bang maximum na makukuha regarding sa subsidy?
Ang subsidy, sir, is ganun talaga ang natin, 20 and 25 and 40.
Okay.
Yes, for the more than one issue is 40,000. For the single issue is 25,000. Yun talaga, sir, ang prescribed natin.
So other than that, ma'am, wala na. Hanggang dyan lang.
Hanggang dyan lang, masubsidize natin.
Okay. Thank you, ma'am.
Yes, sir.
All right, I think that
Sir
ends.
Melvin, sandali ha.
Yes po, ma'am.
Sir Dexter, anong company kayo po, please?
Monolith Construction, ma'am. Development Corporation, MCDC.
From?
Monolith.
From Iloilo ba kayo? Bacolod or wherever?
Manila, ma'am, Manila.
Manila. Okay,
Opo.
Thank you.
Pero para may projects rin yan, di ba, sir? Si Monolith dito sa Iloilo?
I'm not sure, sir, kung meron sa Iloilo.
Alright. Thank you, Sir Dexter, sa tanong po, and Ma'am Lee. And to the rest of our resource persons, thank you very much po for gracing your time, your expertise with us po here in this webinar session po. Alright po, malapit na po tayo matapos. Ay, yes po. Alright, malapit na po tayo matapos po mga kaibigan. So already 12 noon na. Ay, yes po ma'am. Yes po. Meron po bang follow-up question or last minute question? Going once? Going twice? O, game na muna tayo!
Hello, sir. Hello, sir.
Ano po? Parang chat po kasi pwede po i-text, lagay na lang po sa chat box po. Tingnan po natin. Pakilagay na lang.
Good noon.
Yes, po. Oh, yes, sir. Arthur?
Yes, sir. Arthur Malimit, sir. Former second officer sa chemical tanker. Tanong ko lang po, bakit hindi kami accredited to regarding sa mga trainings regarding tong mga, let's say, we also specialized in things like confined space, mga ganon, at saka mga sa chemicals. But parang hindi yata acknowledge yung standards galing labas.
Kay kanina po natin bigay yan, sir. Engineer Ellen, pasok.
Actually, sir, in the Philippines, we have the requirement that for you to be able to give those trainings, you have to be accredited with DOLE. This is a way to ensure that the quality of training that you're going to give are of standard. Okay, so we have to go through with the accreditation process. So accreditation, pwede po yung mga consultant natin magpa-accredit if you have the competency on a certain field of specialization like you mentioned for chemical safety or in a confined space. Talking about other standard, you're referring to other country standard. Please be reminded that we have to follow Philippine standard or the Occupational Safety and Health standard first before we have to apply the standard of other country. Or you have to make sure that you are compliant with the Philippine standard. Okay, so kahit na alam ko there are some countries who have high standard, but you still have to check if those standards are meeting also the minimum standard or requirement in the Philippines. Okay, so
Yes,
we have
ma'am.
the process po for accreditation po. So pwede naman po kayong mag-accredit po. Pwede po kayo pumunta sa website namin and check for the requirements on accreditation po.
Yes, ma'am. Regarding that one, kasi usually it's, for example, itong mga OFW na ayaw nang magtrabaho. I have a lot of friends, especially yung may mga nebos at saka mga ayos, OSHA, coming from a different country. The Philippine standard is taken from the OSHA. Now, the only thing is, why is it that it is not being accredited? Although that is, we have the Philippine standard, but the outside standard is just the same with the standard that we are also following.
As long as they meet the Philippine standard, sir, then there will be no question. Okay, so additional po yun, if they have the NIBOSH, IGC, or even the NIBOSH International Diploma, the IOSH, so if they have that, that will be an additional for their credentials. So if they are going to apply for accreditation, then if they meet the minimum requirements set by the Occupational Safety and Health Standard, then that will be very good for their qualification because they have trainings from other countries.
Yes, ma'am. Kasi right now kasi I am organizing a group here with other mga OFWs with safety trainings coming from outside. Ako galing
We do
po sa
accredit. Yes po, nag-accredit po kami mga OFW po that they have experience on safety and health po. So feel free po to tell them to submit their application po.
Okay, ma'am. Sige, ma'am. Kasi, yun lang din, ina-advise ko rin sa kanila, yung mga boss ko, kunin muna yung mga Philippine requirement. Pagkatapos niya, yung kuha naman, no, itong i-submit din. So at least now, you're confirming that it is accredited yung mga trainings outside.
Hindi. I didn't mean it is accredited, but it is counted. Meaning to say, not the mandatory requirement. For example, if you are working in a manufacturing industry and you want to be an accredited safety officer, okay? So because before you can go to consultancy, you have to pass through accreditation as practitioner. So we have to meet the minimum requirements. Add-on lang po sa qualification yung mga trainings natin that we can acquire outside of the country po, like ni Bosch and Bosch. But hindi po yun ang minimum requirement natin. So they still have to comply with the 40 hours mandatory requirement natin dito sa Pilipinas po. Yan lang po.
Okay po. Thank you.
Alright, so I think we need to cut na po yung Q&A segment natin kasi po it's already 12 na po mga kaibigan. Nagpaparamdam na po kasi yung chan po. So, and also I think I will also cut my last, sorry po talaga, I need to cut also my last round for the games po because of time constraint. So, we will now proceed. Wherein po mga kaibigan, in every event, what has been opened must be closed. And to give the closing remarks for this activity, please help me welcome the Deputy Executive Director of the Occupational Safety and Health Center, Engineer Delia G. Granadillos.
Thank you very much. Our very own OSH REU Region 6 Program Manager. Thank you very much, Melvin, for organizing, hosting this webinar, the third on the KamOSHwag session, episode 3, Food and Beverage Industry, industry-based OSH compliance and best practices. Congratulations, Melvin, and our team in REU6. Thank you very much for this. And the director is expecting more from the episode 3 onwards. We see that you're very active in providing information on safety and health. This food and beverage industry is a very timely and relevant topic for the webinar. We know very well that the food and beverage industry is very hazardous. It may not be on the use of chemicals, but for the food industry, there's a lot of exposure to extremes of temperature. Andyan yung pagluluto, very hot environment. Andyan yung cold storage, na very cold environment. So both extremes of temperature. The noise being produced while manufacturing food and beverage, na andyan po ang lahat ng health hazard. So thank you for organizing this webinar session on the food and beverage industry. First, may I give my greetings to my boss, the Executive Director of the Occupational Safety and Health Center, Noel Binag. Thank you, sir, for leading us in the Vision 1 Million Advocate Program. Ito po ang laking tulong to reach out to all the regions, to all the provinces, bringing the safety and health information. To our regional director, our OSH champion in Region 6, RD Cyril Ticao. Thank you po for supporting us all the way now that we have our team in Region 6. Thank you for guiding us. It's not only OSH, but on the COVID-19 prevention and control. Also, may I greet the OSH practitioners, consultants, STOs in Region 6. I can see po, may consultant po tayo now present in the webinar. Hello, sir. And I would like to give my thanks to the resource speakers. Thank you very much for giving us your lectures na talaga pong sharing your expertise among us. First, on our very own Indasa hygienist, now the regional program manager of Region 8, Engineer Ellen Diaz, Limen Diaz, and on giving us the lecture on OSH compliance and guidelines in the food and beverage industry. I know there's a lot of questions for you, Engineer Len. Talagang nandyan ang interest nila sa food and beverage industry. But may I just add on to the questions? Alam ko ang dami nyo pong tanong. Pagdating sa confined space, pagdating sa indoor air environment, that's the work of the Indasa hygienist. Mabuti na lang po, Indasa hygienist ang ating speaker. But may I just emphasize na for all our participants, tulungan nyo po ang mga kumpanya kasi very clear in the standards that it is the responsibility of the employer, of the company. Though you can request services of our accredited WEM provider, and you can ask services of our consultants, but primarily it is the responsibility of the company. So if you're with the company, you need to build your expertise on this para hindi na po kayo mag-hire. In-plant, in-house, meron kayong expertise in conducting this confined space and indoor air quality assessment, especially on the HIRAC assessment. My special thanks to our speaker on the OSH best practices in the food and beverage industry, sir. Our manager from Marriott Iloilo, Mr. Raul Fernandez. Sir, pwede ba dyan makabisita sa inyo? Thank you for sharing with us. I was surprised you shared with us your crisis management plan, your approach, the total hotel approach, your best practices while in the pandemic. Wala pa kayong sinayang na oras during the lockdown. You provided trainings while sila ay naka-lockdown, ay continuous pa rin ang inyong capacity building. That's a very good best practice. Thank you, sir, for sharing with us ang inyong crisis management plan. Thank you so much. And the last but not the least, our very own Dole family, Ma'am Miss Melinda Lee from the NCMB Region 6. Yan po, ma'am, ang kailangan namin sa pagdating sa aspect on OSH. There's a lot of questions on the compliance. Sila ba ay may reprisal pagka sila ay safety officer at nagsabi sila ng totoo sa investigation? Meron bang reprisal sila? Meron ba silang harassment or medyo may problema po kami pagdating sa implementation ng OSH. Is it legally supported by the Labor Management Council? Thank you, ma'am, for sharing with us your expertise on labor management cooperation towards safe and healthy workplace. I hope po na matulungan nyo po kami sa safety and health. Thank you po. And lastly, for the participants, I want to congratulate po everyone for your enthusiasm, for your eagerness to learn. Nakita po namin ang inyong eagerness to learn kahit na may pandemya. Pero for us in the government, kami po ay continuously providing the information for all of you. Ngayon po, lahat online po ang webinar namin, ang aming training programs. All of these are free para sa inyo pong lahat. Libre po. We're coming up with the mandatory courses on the Bosch SO1, Bosch SO2, and the specialized courses po. Libre po yan sa inyong lahat. Mag-register lang po kayo sa website namin. and you can avail of these training programs. You can also, I've learned also your interest for accreditation. We welcome all your applications for accreditation. Kailangan po namin mapadami ang aming partners through accreditation, ang aming partners na practitioners and consultants. I hope this is not the first for you to attend our webinars. Marami pa po yan, di ba? Sir Melvin, episode 3, 4, 5, and episodes. Abangan nyo po. At may I just give special thanks to our new REU team. Thank you so much, and we've seen your potential in conducting these webinars kay Mr. John, and kay Ms. Nilin. Thank you so much. At it's not only the 200, more than 200 participants, but a lot more nakahook po sa Facebook account na gusto talaga po nilang marinig at matuto ng tungkol sa safety and health. Marami pong salamat. Keep safe at magandang hapon na po sa inyong lahat. Thank you.
Thank you very much, Deputy Executive Director, Engineer Ganadillos, for kind words of encouragement and challenge towards positive change for a safer and healthier working population, especially here in Western Visayas, kung diin, basta gwapo at gwapa, surely Ilonggo at Ilongga yan. Now, mga kaibigan, this officially ends the third episode of our PagOSHwag session in Western Visayas. May I please remind everyone na regarding po sa ating evaluation form. Now, with regards to the evaluation form, can you please click the link below so that you will be redirected to the post-evaluation form. So to those who are present right now in this Zoom account, can you please click the evaluation link po in the chat box for you to be redirected to the post-evaluation form. Once you are able to accomplish the post-evaluation form, it will be encoded po mismo sa aming pong portal, and for that, you will be provided afterwards within the week or so with your electronic certificate of participation. Kapag walang post-evaluation form po na accomplished, walang electronic certificate po tayong lahat. Clear po ba? So kindly please accomplish the post-evaluation form via the chat box below po. Once again po, nandiyan na po sa ating chat box po yung post-evaluation form. And if ever po may mga karagdagang katanungan po tayo or clarifications regarding po sa ating mga resource persons or sa topics po natin ngayon, you can do so via our email address or pwede rin po to message us sa aming Facebook page po. So with that po mga kaibigan, thank you very much for joining us in this Zoom and Facebook Live. Now on our next PagOSHwag session, we will be tackling on OSH compliance and best practices in the public sector. Tingnan naman po natin kung kamusta naman po yung OSH in the public sector po, mga kawani ng gobyerno po natin. Now we really hope to see you again soon in this upcoming endeavor kasi open rin po for the general public po yung ating webinar po. Now to the lucky winners of our 4-pick 1-word segment, please do not leave the meeting yet for we will be directly communicating with you on how you'll be able to acquire your prizes. Kasi po hingi po kami ng additional information niyo po. Now to be updated on the latest schedules and other OSH activities here in Region 6, please like us on Facebook and subscribe to our blog site. Once again, this is Melvin together with the regional team and central office support staff saying lahat tayo pwede maging OSH champion. Padayon sa PagOSHwag, mayong adlaw sa inyo nga tanan. Happy lunch po everyone.
Okay, na may inisdanan. Oy, ha? Dito na. Dito na sa kuwan.